Good evening, everyone. I would like to go over a few rules. One, we'd ask that everyone be respectful of each other. You know, we need to allow people to speak. The gentleman back there is videotaping. We're also recording everything, and this young lady is transcribing the meeting, so it's difficult to get everything down if people are talking over each other. So I'd ask that everyone give each other an opportunity to speak. If you have a question or concern, board members as well, please raise your hand, and we'll give you an opportunity to be heard within reason. Also, anyone wishing to address the board must sign up. And depending on the number of people who wish to speak, we will impose time limits. Historically, it's my understanding that a number of people have signed up this evening, but historically the time allotment was 2 minutes per person. It's my understanding that that was what had been done historically. We got away from that due to the pandemic, but we are going to implement that policy this evening. We're going to return to that policy of 2 minutes per speaker. We'll give you a little bit of leeway given that it's the first meeting that we're doing that, but historically the time limit has been 2 minutes, although we've been very flexible in the past about that time limit. It is now 2 minutes. So we ask that you limit your remarks to 2 minutes. And also profanity and yelling will not be tolerated, and anyone using profanity or anyone who is yelling will be removed from the meeting. If you are unable to do this, I am kindly asking that you leave at this time. In this meeting, everyone will be treated with dignity and respect. I thank you for your participation as well as your consideration. With that being said, we'll do a roll call now. Pat Katina.
Chairman Halsey, I am Pat Katina's official designee for every meeting.
County Executive
Steve Polarski for the county executive.
Terry Klein.
Present.
Judge Lazara.
Present.
Gail Moss.
Present.
Acting Controller Tracy Royston.
Ryan Herbinko on behalf of Acting Controller.
Sheriff Kevin Kraus.
Jack Kearney on behalf of Sheriff Kevin Kraus.
Good evening and welcome to you all.
Judge Halsey, point of order, please. I would just like to, for the record, object to illegal designees being present and voting in this board. Only the president, judge, and the county council president get a designee to this board. Everyone else has to either come themselves or they don't send anyone. So I would just like to object to any illegal designees here today.
Thank you very much. With that being said, we'll have a verse presentation.
Hey everyone, I'm Renee Madden. I'm the Deputy Health Services Administrator of Behavioral Health. I'm here for Dr. Brinkman this month. So I'm going to give you an overview of the mental health tier system that we use. Allegheny County Jail has been working to develop our mental health care, and we have implemented a tool referenced as our mental health tier system. This was created through review of best practice and collaboration to support the interdisciplinary teams on our mental health units. This mental health tier guide determinations related to levels of care. Levels of care are commonly used in mental health to support treatment by indicating where patients are at in their psychiatric stability. They provide guidelines for recommended treatment modalities and interventions. The mental health tier system was implemented in December of 2021 after efforts initiated at the beginning of 2021. Development included members of the treatment team from our frontline staff, behavioral health care professionals, and our partners through Allegheny Health Network, including behavioral health, advanced practice providers, and psychiatrists. This tool was one of our first steps in the evolution of mental health services at ACJ and continues to be revisited as our services expand. It is intended to set the foundation of overall program growth and development. The tier system ranges from 1 being least restrictive to 5 being most restrictive, as informed by the patient's clinical stability. Generally speaking, when assessing risk, clinicians are looking at suicidal or homicidal ideation to include plan, means, and intent. We're also looking at protective factors to conclude an overall risk level. Based on the assessment conclusions, clinical recommendations are made for safety precautions to protect the patients and others. Clinical recommendations are then carried out by the interdisciplinary team to include behavioral health providers, behavioral health rehabilitation specialists, or formerly known as psychiatric aides, mental health registered nurses, mental health specialists, therapists, and support from level captains, sergeants, and pod officers. This is one of the many examples within ACJ where we have a nice collaboration with custody and healthcare. As the tier system is rooted in application of the least restrictive level of care practice in behavioral health, lower tiers are reflective of clinical recommendations corresponding with ongoing clinical assessment. All assessments are informed by supported information from the treatment team to then inform the assessing clinician of overall clinical presentation and functioning, which may not be observable at the time of evaluation. As our tier system includes clinical recommendations on safety precautions, these are often referenced by a variety of interdisciplinary team members in context of restrictions. However, they are clinically rooted from the assessments. At times, these may even be referenced in the context of our 205 referendum as one of the exceptional criteria for emergency use of short-term solitary confinement. This criteria includes medical reasons with an evaluation certifying medical necessity. In healthcare, psychiatric assessment finds clinical evidence of imminent risk of harm. It's considered a medical emergency, which requires both urgent and restrictive intervention to support what is being assessed. These assessments and re-evaluation procedures are not only compliant with the 205 referendum, but are also seen in typical acute psychiatric care and psychiatric guidelines in community settings. Tiers also outline the items allowed in individual cells due to clinical safety restrictions and recommendations for out-of-cell time and guidelines for the documentation and interventions needed for each clinician at each level of care. So in conclusion, we expect to continue our growth from this implementation. Thus far in the process, we only have anecdotal observation of its successes, and we have seen overall improvements with treatment team communication, collaboration, and coordination of care on our mental health units. In the future, we would like to be able to have specific measurable outcomes that we can report to demonstrate our success. Thanks.
Hi, thank you for your presentation, first of all. I appreciate it.
Sure.
I'm concerned, like, have you all considered at all whether this was a violation of the ADA, limiting or eliminating rec time based solely off a person's disability?
So any kind of restriction is going to be clinically necessary. So we're going to look at safety reasons, and it's constantly being assessed. So even like kind of how I was saying, even at the time of evaluation, if it's not shown, then it's going to be supported by ongoing assessment from clinicians that are on site.
Can you specifically say which tier level would result in solitary?
Sure. So as it ranges, 1 would be the least restrictive and 5 would be the most restrictive. So if somebody is at a level 5, they're going to be like actively harming themselves or actively having suicidal ideations.
Can I follow up? Sure. So I'm taking this that only tier 5 would be clinically indicated to be on solitary.
Yes.
Thank you.
Mm-hmm.
Just to follow up to that, can you say which of these tiers are resulting in people who are being handcuffed to their table during recreation?
Without looking at them specifically, no.
So it's not like if you're a tier 3, 4, or 5, you're chained to a table during rec, and if you're 1 or 2, you're not?
Yeah, it's going to depend on the assessment at the time and the patient as well.
Okay, and who's
the tier that
conducting?
they're at.
Who's conducting those assessments?
The clinicians.
The clinician. So is it like, is there a title? Is their title literally clinician? Sorry.
It's okay. The behavioral health providers.
Uh-huh. Mm-hmm. And that's a person who's staffed within the jail?
Yes.
Okay,
Yep.
thank you.
It's not really a question. It's a nice to meet you, Ms. Madden. Ms. Madden does help with getting people placed outside of the jail, and she deals with people who have the most serious issues and trying to get them moved into the community. And I know Ms. Madden, I've given her 2 of maybe her toughest cases in the jail, and she has been working so hard. And I just really wanted to thank you because if you can, the one is already resolved, the other one, we're all keeping our fingers crossed and praying that we can get her out. But I really appreciate your efforts because it's made a huge difference. So thank you.
Thank you so much.
Thank you very much. Stoughton?
Good evening. I'm Joanne Forster, the Director of Performance and Analytics for Allegheny County. I am working with a team of people who are involved in producing the data for the compliance with the referendum on restricting solitary confinement. As I said, I'm the Director of Performance Analytics. I have a team of people that work with me called County Stat. We do data governance, data management, analytics for county operations, as well as managing the county's open data program in cooperation with the Western Pennsylvania Regional Data Center. With me today are a member of my staff, Jeffrey Arnold, who is the coordinator of strategic analytics, and we work very closely with the Department of Human Services in the production of this report because of their in-depth experience with criminal justice analytics for the county and for the jail. So Erin Dalton is here with me, who's the Director of Human Services and a member of her staff. Wilson Wee, who is the criminal justice manager of criminal justice analytics for DHS. I'm going to let Erin say a few words before we do more of an explanation of the report.
Great. Hi, everybody. Thanks, Joanne. I'm Erin Dalton, the Director of the Department of Human Services, and here, just as Joanne said, to help walk through the details of how this report is prepared. So I'll, with that, just turn it over to Wilson and Jeffrey.
Actually, I'm gonna take the first part. Thanks. So one of the things that we want to do in setting the stage for Wilson and Jeffrey's more detailed explanation is to at first explain a few definitions. So the county's definition of solitary confinement is restricting an individual alone in a cell for 20 hours or more in a day. And while Wilson will explain how we get at that information at kind of a high level, so you understand, we are looking at the individuals in a segregated housing unit that are housed alone in a cell and have not been offered at least 4 hours of out-of-cell time that day. Segregated housing units currently are pods 5C, 5D, 5MD, and 8E, as well as parts of pods 1C, 5F, and pod 5MC just as needed. We get this information monthly from the warden in terms of which pods and which parts of pods are being used as segregated housing. In addition, we look at individuals who may not be on segregated housing units, but are in other pods, general population pods, but are in medical isolation or on suicide watch so that we can be sure that they are included in the report as well. Other than that, our analysis does not look at individuals who are in the general population pods because except during lockdowns of those pods, which are done for medical or safety reasons, those individuals are not confined to their cells throughout the day like individuals on segregated housing units. Another definition that comes into play is the definition of a day, believe it or not. We do not use a calendar day or day of the week for purposes of this analysis. We start our definition at 7:01 a.m. through 7 a.m. the following day, and that's so our definition of a day coincides with the shifts of the correctional officers, as well as the recreation timetable for individuals in the jail. Third definition that comes into play is offered out of cell time. Any time that an individual is offered out of cell time for recreation, showers, court time, etc., is recorded. If the individual refuses to take advantage of the out of cell time or returns to their cell earlier than required by staff, that is noted, but the offered out of cell time is what is used in the calculation. Mental health tier designations also come into play, as you heard from the previous presentation, and the warden provides us with that definition so that we are coinciding with what the mental health team is doing in terms of restricting individuals. So I'm going to turn it over to Wilson, who's going to get a bit deeper into the analytic process.
Thank you, Joanne. So Joanne just explained the criteria of how we're defining segregated housing individuals. However, that isn't a feature in OMS, the jail's offender management system. So we have to actually extract that information from the information that we do have from that system ourselves manually. And we could do that by grabbing the housing logs, the population audit logs, and the activity logs from OMS and from the activity logs given to us by the jail. Now, to do this, we start each month with the warden providing us with some parameters of analysis. Now, what do I mean by the parameters of analysis? Well, first is the analysis dates. Now, for every single month, we're not doing this analysis for every single day because there may be some days for which the jail is locked down, say for a COVID, outbreak, whereby out of cell time is atypically restricted. So first we define what days we're analyzing. Second is we are defining, or we're provided what units we're considering segregated housing units, as Joanne just explained. And the third is the the mental health exclusion tiers, which we use to exclude individuals who may not be provided the mandatory 4 hours of out-of-cell time. So those parameters are setting the criteria of our analysis. From there, with those parameters, we've written a program that takes OMS logs mentioned previously, and we identify the number of hours each inmate was in a segregated housing unit. Now, and that's in a segregated housing unit alone per day. Now, after we have that list, there's another step we have to take, which is then we have to go to the activity logs, and we have to identify the number of hours each individual was offered per day. And we subtract that from the number of hours that we believe they were in the cell. And from there, we find all the individuals who were in a segregated housing unit alone per day as our final segregated housing list. After we're gotten that list, then we add the demographic information to give a fuller idea of what that segregated housing list looks like. Now the activity logs are actually quite complex, and my coworker Jeffrey Arnold is going to explain a little bit in more detail what is inside the activity logs in detail.
Hi, everyone. So as Joanne and Wilson have alluded to, OMS does not currently have implemented in it a good way for the jail to track activities for individual inmates. So what we created for them was a templated spreadsheet that are used every day for each pod. So this gets to roughly 210 different Excel files that Wilson has to go through for his analysis every month. At the end of every day, those documents are then uploaded into the document management system and are reviewed and verified by jail staff and sergeants. So basically everything in the definition section that Joanne mentioned is tracked in these activity logs. So the medical status is tracked by guards and reviewed by the medical staff to make sure that we are correctly attributing that to the individuals. We check to see whether or not in the activity log if the inmate has been newly transferred to the segregated housing unit, as this normally will indicate that they do not get offered out of cell time. And then we also have fields in there that track each of the types of activities that will be offered to an inmate throughout the day. So those include shower, recreation, court appearance, video conferences, and other programs and services. These times are then entered and calculated in the fields. We use the identifier of the inmates that are in both the OMS system and the tech care system to basically attribute the offered amount of time to each of those individuals. So with that, I believe I'm giving it back to Joanne to talk about quality. Oh, Wilson? Okay.
So as everybody can kind of gather now, I think they can see this process is quite complex, and therefore we want to implement some quality assurance checks along the way to make sure that all the data is of the highest fidelity. So there are a number of things that we do both programmatically and business-wise that we perform throughout the month that kind of checks the data to make sure that everything is accurate and correct. One of the things is we've implemented a very strict file naming system for these activity logs that identify the pods and the dates for which the activity log should reference to. And then I programmatically also double check each log to make sure that the data in there is accurate reference to that date and to that pod. Another check that I perform is to make sure the DOC number, which is the ID that we use to identify each inmate, is accurate and that there are no duplicates. What that ensures is that every single inmate actually gets attributed, that the activity that they're offered, that time is being attributed to the correct person and that it is not being duplicated, so that it would not show that we're offering more activity, out-of-cell activity, than they actually are. Another thing that I check for is duplicate entries to make sure that within the activity logs, there aren't offered activities in the same time slot. You can only offer one type of activity, out-of-cell activity, per time slot per person. And then finally, another check is whether there are duplicate logs. Because we're tracking, as Jeff said, upwards of 200 logs a month, it is possible that a log could be duplicated, and therefore the amount of out-of-cell activity might be overcounted. So I also check to make sure that there are no duplicate logs by checking the name and also the entries in there to make sure that no entry is duplicated. There also are a number of business practices that we perform to make sure that the data is of the highest fidelity. One is that we run this process weekly. I run this process on a Tuesday. Any errors that I have from the activity logs, I report back to the jail staff and the county stats staff, and then they make the corrections, and then I run that again by Friday, in theory, correcting all the mistakes that we may have had, so that each week along the way, all the data should be correct, so that at the end of the month, we're not racing to correct everything all at once. The staff, as I understand, also review random samples of videos to make sure that the staff is actually offering the inmates the out-of-cell activity time that they've indicated in the logs. And then finally, as Jeff had mentioned before, the medical staff and the jail is checking the activity logs every single day to make sure that the medical tiers that's indicated in there actually matches what's in tech care, the electronic health records. And doing those consistently throughout the month ensures that the data that we're using to analyze this is correct.
So just one final piece of information for you all. As we've described, this is a very tedious and time-consuming process, tracking and recording individual movement in and out of cells across, every day across all of the pods that are involved with segregated housing is time-consuming, and it's being done now with correctional officers recording in spreadsheets. And I don't know how many of you deal with spreadsheets on a regular basis, but that is not an ideal situation. We have an offender management system that is designed to track information about inmates, and what we're in the process of doing right now is procuring the additional module in that software system that will now enable this to be done within that offender management system, removing at least a couple of parts of what Wilson has to do, as well as making it easier on the correctional officers so that they don't have to be going into spreadsheets, but can be doing this as a normal course of their processes, dealing with a system of record that they're accustomed to using. We're also in the process just incorporating, I believe, this Monday, being able to pull out of the electronic health record system directly the information about the tier designations. So there are some improvements pending that will make this process less burdensome for everyone involved, as well as minimizing opportunities for human error. So did you have anything else, Aaron, to add? Or so I guess there are questions?
Yes, Ms. Hallam.
First of all, thank you so much for your presentation. Really appreciate you coming after hours to come talk with us all. I just have a couple questions, and it's kind of like addressing all ends because I don't know like who said what. I didn't write that in my notes, but so the first thing that you mentioned is you were talking about like following the definitions of the referendum and of certain things. Where are you getting those legal definitions from? Are you getting them from a certain solicitor, the law department?
So this is a definition that collaboratively the persons involved in senior management and county government have determined is the correct interpretation and definition to be used.
Is that a legal team? Are they lawyers?
The solicitor's office is involved, yes.
Okay, so because I'm specifically wondering, you talked about in your counting, you talked about folks being alone in a cell, and that's what you're counting is when they're alone in a cell and not let out for at least 20 hours in the day?
Correct.
Where in the referendum, because I assume you have all read the referendum, right? Because you seem to be doing a lot of work on it. So where in the referendum does it say anything about being alone in the cell to be counted?
So I can only speak to the definition that we've been provided as the analytic team to use for purposes of producing the report.
Okay, so you were told to count them only if they were alone in a cell, not if there were two people for 24 hours in a cell.
Correct.
Okay. The second thing is that you talked a lot about offering rec, and if they weren't offered rec, but also I don't see the word offer in the referendum at all. So I'm wondering why it's being accepted that it was offered.
So offered recreation gives an individual an opportunity to be out of their cell. So that's why we look at offered recreation or offered time out of cell.
Even though the referendum says out of cell time, not offered out of cell time, I was just wondering why you drew that distinction.
So I might stumble on the words of the referendum itself, but my understanding is that if a individual is not confined to a cell, if they have been offered timeout, that would mean that they were not confined to a cell.
Okay, and is that another definition that came from this collaborative
yes.
team? Okay, thank you. And then another thing, you talked about excluding people from the counts who can't be provided rec. Who are those people? And I don't know whose presentation it was, someone.
So this gets it to the persons who are designated as having tier 5 or other, or on medical isolation, which I don't think that falls under tiers. But so persons who are not able to be out of their cell because of a designation like that, medical isolation or a high tier designation, then those people are included on the report, but they're listed as having a medical reason for not having time out of cell.
Okay, great, and this is my last one. So I have no idea what OMS stands for. I will just be clear, what does that stand for?
It's Offender Management System.
Okay.
That's the software that's used to track, to record basically all other kinds of information about individuals in the jail.
Because as you were all talking, we have been looking for a way to track the hours worked by incarcerated people in order to possibly implement a pay structure for incarcerated workers. And a problem that we've been coming across is how do we track how many hours they're working across each department, who's working on what? And I'm wondering if, just broadly, if this system that you're using to track folks, and you said like a vendor management system with an Excel analysis, all stuff that's way above my pay grade, but I'm just wondering if there's any way that tracking system could also be used to track incarcerated workers.
I honestly have no idea if the offender management system has that capability.
Okay, but you are using it to track if they have out of cell time.
No, we hope to use an additional module that vendor has to do that.
Thank you all so much. I appreciate it.
Mm-hmm.
Any additional questions? Thank you very much. Thank you. Now I'll have the Community Corrections Report, Passages to Recovery.
Hi, good evening, everybody. My name's Kevin Cordsey. I'm the Director of Residential Services for Passages to Recovery. Basically, what we've been working on is we've been updating our clinical schedule. We've added resources, evidence-based practices for curriculums, both handouts, materials, and also curriculums themselves for services within the agency. Also been bringing in outside providers such as Maya, Pennsylvania Women's Work, and other peer and recovery support agencies to also offer services and provide services within the program itself. Recently, we've also added a new psychiatrist that has given us some additional support, allowed us to make changes with medications rather than just maintaining what some comes out on. One of the things that we've kind of recently been running into is being able to get people connected to community-based mental health services. So with having a psychiatrist, the amount of time he's given us, we can make adjustments to medications rather than maintaining something that might not be optimum for someone and waiting until we can get them into a community-based program. So that's it.
Any questions?
I'm sorry, I've raised my hand. Has everybody moved from the Oakland facility to the West Homestead?
Yes, we moved everyone on the 19th of April, so we've been co-ed since then.
Okay, and how is the co-ed going? There's, I'm sure, firewalls to make sure that there's...
Well, the easy thing about the facility is that it is one hallway. So we don't have a lot of corners, no stairwells, one floor that we have to manage. So by combining programs, we haven't laid anybody off. So we've been able to increase the amount of staff that we have in the one facility, and it's gone very well.
Good. Glad to hear that. We're trying really hard in the courts to make sure that we're using the new name,
yes,
as opposed to acting female offenders. So, we're trying.
All right, I appreciate it.
It'll take a while.
Yes.
Thanks.
Any additional questions? Thank you, sir.
Thanks.
Renewal Center.
Good evening, everybody. Adam Zach reporting for the Renewal Center. This past month, we had our American Correctional Association audit. It took place on April 11th and April 12th. During the audit, out of 32 mandatory standards, we received a 100% with no deficiencies. Out of 210 applicable non-mandatory standards, we also received 100% with no deficiencies. This is unofficial. This was just the finding of the auditors, but the accreditation won't take place until several months from now. But we're certainly pleased at the outcome thus far. This week is National Correctional Officer and Employee Appreciation Week. Our staff had several dress down days. On Monday, we were treated to lunch from the Mission Mahi food truck, and we've had a couple other perks throughout the week. So our staff is very appreciative of this. And this past Sunday was the Pittsburgh Marathon. I don't have a number of how many participants we had, but we had quite a few re-entrants. They helped out handing water out and fruits and heating blankets at the finish line. Also helped out with the setup and the cleanup after the marathon. So they gave back to the community. They were very pleased, and that's all I have.
Any questions? Thank you. Well done. Keep up the good work. Thank you.
Thank you, everybody.
Mr. Scheer.
Good evening. My name is Frank Scheer. I am the Director of Adult Probation. So I actually have two items today to present. The first will be our electronic monitoring report. You should all have a copy of that in your packet. The only thing I'd like to point out, our number increased significantly from last month. An initial 185 individuals were placed on electronic monitoring since we last met. So that's a good thing. That keeps the majority of these folks out of the jail. So, and that's our purpose here. So any questions related to the report?
I'm just curious, what do you attribute the increase to, other than judges?
I'm going to say it's me.
I'm going to say, yeah, the judges. Your Honor, I would just, I'm speculating, but I would say you are catching up on dockets from COVID and some things of that nature. That is a little abnormal, that number. It seems a bit high to me as well, but we have the equipment, so we're good to go.
Is that pretrial as well? Pretrial and?
Well, that's our total population, but our pretrial number is 114. I don't recall what it was last month, but I know it was fairly low with that. So I'm going to, again, speculate that number's up a bit as well.
Do you think that if that number continues to increase, you'll experience the delays that we've seen historically with people getting equipment and being banded?
I would say not for a while, Your Honor. We can handle up to about 1,000 individuals. Anytime after that, we may run into equipment issues, availability, as well as more than likely manpower issues.
Okay.
So I think we're still good for quite a bit of
All right,
time.
thank you.
You're welcome. Any other questions? Yes, ma'am.
I have a question. Are we on the treatment plan yet?
We are not.
Okay, well then I have no questions yet.
Okay, the second item is what is known as the Allegheny County Intermediate Punishment Treatment Plan. And I understand there were some questions related to why I am presenting that to the board today. Quite simply, it's required by statute. The last 2 years, we did not have a plan in place because it was waived because of COVID. The intermediate punishment plan is a requirement to apply for any type of grant funding within Pennsylvania. So it's a requirement that we must have in order to apply for funds. So I will be very brief, and then I obviously will answer any questions that anyone may have. So just to go through it again, we are required by statute to answer a number of different sections related to statistical needs. The jail's population, that information is taken from their jail website. The county's population, when I say county, the county probation population, the electronic monitoring probation population. We also indicate some of the other programs that are available, such as the alternative housing, therapeutic housing programs that we have. We also have an opportunity to ask for additional funds through what is called future needs. The second part, we're required again to provide some stats as well as potential impacts the electronic monitoring program has. Again, as I mentioned, we review current alternative and pretrial detention programs in the county. Number 4, description of existing resources in the county that can be used for probation with restrictive conditions. That one's fairly lengthy. Any type of policy statements and any type of goals and objectives. And the last thing deals with measurements, and that's related to the presentation we provide you every month with our statistics. So that is a very quick review. Again, these were sent to you ahead of time to review, and I am available to answer any questions.
Ms. Hallam.
Thank you. So my first question is, will any of this funding be used to eliminate or at least reduce the cost of people on electronic monitoring or their families?
Do you mean the
fees associated?
Fees. It is not permitted to
It's not allowed.
Fees, correct.
Okay.
If I can,
yeah.
I believe you asked me that last month too, and I just to be clear, we do have a scale system based on income, as low as $1.50 a day. But we also will not turn anyone down who's indigent or can't afford it.
Okay, thank you so much. And then the second thing is, with this additional funding, does any part of your plan work with the courts or anything to get people out of the jail and onto electronic monitoring instead?
Yes, that's basically the justification of the plan. Basically, me letting you know that the reason we have this plan is to get folks out of the jail. And if you look at the first report, you can see the breakdown of, those are all mandatory sentences, particularly the...
Can you tell me where that is in here?
The first report I mentioned, my very first, the electronic monitoring population report.
Okay.
Where it says IP sentence, 369. Those are DUI cases for the most part. Those are mandatory sentences. I'm sure the judges could explain that, but that means this program's not available or our alternative program is not available. They're required to serve their sentence in jail.
Okay. And then my last question is, I know you said that this is, like, by statute, you have to go through us to get this approved and that it was waived the past 2 years, but what happens if it's not approved? Like, what do? You just don't get the money or what?
Well, so I reread the statute and went over this, and to be honest, I've been doing this for as long as since Judge McDaniel was in Judge Housey's seat. It's actually not required to have a vote, so I just am required to report it to you all and answer any questions.
Okay.
So
thank you for doing that.
That answers your question.
It does. Thank you so much.
You're welcome. Any other questions?
Any additional questions? Thank you very much, Mr. Sheriff.
Thank you, Your Honor.
Hopefully everyone had an opportunity to review the minutes from the previous meeting. Assuming that was the case, does anyone have a motion?
So moved. So moved.
Anyone seconding?
Second.
All in favor of approving the minutes?
Aye.
Any opposed? The minutes will be approved from the previous meeting of April 7th, 2022. Old Business Suicide Prevention Subcommittee. Warden Harper.
Good afternoon, Board. I just want to report to the Board that we did meet with the NCCHC on May the 3rd to discuss them returning to our jail to review our abatement to their suicide review. They're going to present a plan to me, giving me what the cost would be, and it looks like it will be around July or August that the NCCHC will return to the jail to review our abatement plan. That's all I have, Your Honor.
Any questions? Ms. Hallam.
Yes, so I have a question regarding the padded cells, which were one of the things that you put in as a result of this report. Are you tracking the number of folks that you are putting inside the padded cells? Is there a report on that?
The suicide-resistant cells have not been utilized yet.
Okay, so, because I saw some of them, they're just not being used yet. Right, and you don't have to answer that. I know that's the same question I just asked, so you don't have to answer that. Yeah.
If I may, it's not that they're available to be used, we just haven't had to use them, correct? Or the jail hasn't had to use them, I don't.
7 of the 10 cells are complete. Part of the update I was going to give Ms. Allen was, from last month I reported that 7 of the 10 were completed. We're still in a holding pattern waiting on 3 replacement locks for the 3 remaining cells in the intake department. The other 7 that are within the jail are ready to be used if needed, but they have not been used. Okay.
Thank you. One follow-up question to that. So is putting someone in a padded cell the same as putting someone on suicide watch, or is there a reason that someone would be in one and not the other?
The individual's behavior would be self-destructive. They would be actively trying to harm themselves if we put them in one of those resistant cells.
Okay, that's what I was wondering, if there was ever someone who was on suicide watch not in a padded cell, or in a padded cell for a reason that wasn't suicide watch.
We have individuals on suicide watch not in padded cells, correct?
And why is that? Why are they not in the padded cells if they're on suicide watch?
They're not actively engaging in self-harm behavior.
Okay, so that's the short term when they're actively engaging.
Correct.
Thank you.
Because the padded cells that are completed are free of ligature points or anything that they can harm themselves with.
Okay, thank you so much.
You're welcome.
Any additional questions? All right, with that being said, Warden Harper, you have a report regarding the tablets in the jail?
Your Honor. The board asked how many tablets we had at the ACJ, and we did a count, and our current tablet count is 1,462.
Any questions? Ms. Allen?
Yeah, so that number is lower than the total population of the jail. So is there an order in for new tablets? Do you, and also what, like inventory number would you like the tablets to be at for you to feel like happy?
Today's count was 1,505, so therefore we're only short 43 tablets. Majority of the inmates that's on our mental health units are not authorized to have the tablet, so the majority of our inmates do have a tablet. We do have a large order of tablets that has been placed, but of course we know with supply and demand, it's really difficult to get them in a timely manner, but an order has been placed.
Thank you, Warden. And do you know off the top of your head what that large order was? Are we talking like 100 or like 500?
I really don't.
You don't know? Okay, thank you.
Any additional questions? Thank you very much, Warden and Deputy Beeson. Update regarding the Prison Society for Liaison.
All right, hello, everybody. As you all know, we have been trying really hard to get this liaison position moving forward because we think it will just be incredibly helpful for the board as well as for the jail. We had engaged in a lot of conversations with the Pennsylvania Prison Society. We were trying to contract with them to provide the liaison. Those discussions went back and forth quite a lot. It finally came down to the final discussions, and there were simply some points that this board could not agree on with the Prison Society. So that will not be moving forward. The PA Prison Society will not be providing the liaison. I would have to say that the board was unanimous in the requirements that we had from the Prison Society for that position, and the Prison Society simply was unable to meet those requirements. And so that's the reason that that will not be going forward. The board has been discussing various other ways that we can get this liaison done. We're thinking that we will have someone hired, that they will be placed somewhere in the, I want to say county structure, somewhere within the government in Allegheny County. That has not been finalized yet, so we at this point don't want to make any announcements along those regards. But those discussions are continuing, and we're hoping to be able to finalize where that position will be housed within the next, I'm going to say, week. But hopefully by the next meeting, we'll be able to absolutely tell the public about that, okay? Any questions? we're going to get it done. I know it's been a long time, but it's absolutely going to happen.
Mr. Polarski, update regarding compensation for work performed by incarcerated individuals?
I don't know what update I can provide other than what I provided a few meetings ago. I know there would be, this has come up, and I'm no finance attorney or legal attorney, but there would be issues. We talked about potential union issues with it being similar work if you paid a wage. I know some background in the state prisons, they pay, I think, the highest wage. It's like 54 cents. Those are workers that go outside, do landscaping and maintenance, or go paint a church or something like that, where a lower wage was about 17 cents an hour. Talking to some people, they get paid for 40 hours a week. They don't regularly work 40 hours a week, but they still get paid. We provide more money up per month on their commissary kind currently, and it goes to every individual. So I think we're going above and beyond already now than what was normally in a state prison. There would be some consequences that we would have to work out if we went to that. We've talked amongst ourselves, like court costs and any restitution if the incarcerated individual owed that. I know in the state, any money you make has to go off to pay certainly restitution before you would do that. If you paid above those amounts, again, I'm not a tax attorney, but I do know if you make more than $600, then that employer's obligated to give you a 1099, so there'll be consequences for those people. We don't always have good addresses for people that leave the facility, so there could be some unintended consequences where someone doesn't report their taxes because we didn't report back to them. I think in theory, it sounds like a very good idea, but I think we as a board already provide more than what somebody that gets paid in a state prison, actually makes per month. But again, probably said it enough. I am not a tax attorney, but I know there would be unintended consequences and some issues would have to be addressed if we went towards that. That's what I was able to ascertain just in a brief review.
So I just will point out, I did the math while you were talking. Currently, we give inmates $100 each for commissary and for their tablets, and the highest paid inmates in the state, incarcerated individuals in the state system, are paid $92 per month. So we're currently, I think your point is, we're currently giving the inmates more money than what inmates earn in a state correctional facility. And I can attest to the fact that, as a concern, that inmates that are responsible for paying restitution and or court costs, a large portion of those earnings are earmarked for restitution and court costs. So that's also a concern that you discussed. I can attest that that is the reality of the situation. Any money earned in a correctional setting is required to be paid. A portion of that money is required to be paid towards restitution and court costs. Ms. Hallow.
Thank you, Judge Halsey. So I just have a couple things to go off of that. So first of all, I wanted to let the board know that this week I formally requested that the Controller's Office do an audit of the workers in the jail. How many hours are they working? All we've been able to get so far through my requests via County Council have been how many people have jobs in the jail. We haven't been able to get any information despite multiple requests on how many hours each person is working. So I think that's very important. So I wanted to let the board know that I put in that formal request this week. Additionally, when we talk about what the pay of incarcerated workers at state prisons are, it's ridiculous what they're getting paid, right? So I don't think that we need to use that as a standard. And especially every single person in upstate, they're convicted of a crime, right? In our jail, only 5% of the people were convicted of a crime. So I think that that's important too, that although people were in there on detainers and for probation violations, and that's the majority of what it is, they're not actively serving sentences, most people who are in there. So I think that that's important that we look at the distinctions between the state and the county. And if we're the first to do it, heck yeah, that's great. Let's give ourselves a pat on the back for doing something right at this jail. I think that's a great thing to lead the way and show that we value our workers, not just the ones who choose to go in and out of the jail every day, but also the people who are in there and working. And so I'm really interested to hear what the Controller's Office has to find as a result of my request. I know that it was close to today, so they don't have it yet. But what I would like to ask Mr. Polarski, since you are here for the county executive, if you could, compile those concerns with paying incarcerated workers for our next meeting, and that we can, go over it as opposed to, I know you know it pretty well and you're just listing them off your head, but maybe if you could distribute to all of us the specific concerns that the office has with paying incarcerated workers, and then we can go through them and try to find solutions ahead of time.
To be clear, I didn't say there was a problem. I just said there's things that would have to be addressed. So I'm not saying, personally, I think there's a problem or I'm opposed or unopposed. There are unintended consequences that certainly have to be addressed before we could sit here and say we would pay those individuals, not pay those individuals. We can't make people work. My point is we are giving people more than they would make working, and that goes to everybody, not just those minimum, a small amount of people who would volunteer to work. So we're giving more money to everybody than they would make actually coming to work. So I think the intent of doing it, we've already reached that to a point. We've already reached that goal of getting those individuals money.
Why not do both? We can pay everyone $100, and as you've seen by the balance of the inmate welfare fund, the incarcerated individuals welfare fund account, that every month we're giving out like $160,000 and the fund balance stays the same. I actually don't think that this, in my vision at least, of incarcerated worker pay, the money doesn't come from the incarcerated individuals welfare fund. It could, absolutely could, if that's the only way we can get it done, but why not pay the staff at the jail the way that we pay the other staff members at the jail? They are doing work that would be done by county union employees otherwise. So the fact that we're taking those jobs away from county union workers and giving it to incarcerated individuals and saying, well, we can get their labor for free, that just doesn't sit well with me. So all I'm asking is that whether it's your concerns or whatever, if you could bring all of the issues that you think need to be discussed prior to implementing this to the next meeting, I think that would help move this process along a little bit. So thank you.
I just had a question. I just want to make sure I understand what you're saying. So you're suggesting that incarcerated individuals should be paid $15 per hour by the county while working in jail?
No, I didn't say $15 an hour. That'd be great. Heck yeah, give them $15 an hour, sure. I actually think, I know we have discussed this multiple times already, and I don't think we're at the stage of deciding exactly what the wage is, but I think that it's fair if we tie it to the state or the federal minimum wage.
What is that?
It's already a $7.25. Is it $7.25? Yeah, $7.25. Again, it is still much lower than we would pay any county employee who would do the same jobs that they're doing, whether that's kitchen work, laundry, general cleaning, maintenance, that sort of thing.
And your position is that they should be paid by the county? I just want to understand what you're saying.
They should definitely be paid for their work. I am very open to whether it's paid by the Incarcerated Individuals Welfare Fund, where it is clear we have plenty of money and we do not need any other authorization other than a simple majority vote of this board to implement that. But when we had voted to start exploring this months ago, we hadn't yet set exactly where the money was going to come from, how much it was going to be, any of the specifics. We had only voted on starting to look at it. But yes, if you're asking Bethany gets to decide, absolutely. Let's pay them as much as we can get everyone on this board to agree to. Let's have it come out of the county fund. But at the very least, this fund balance, this is their money. This Incarcerated Individual Welfare Fund is funded by the profits that we make off of them buying basic food and hygiene products every month. Absolutely, that's their money, and it should be their money. And the fact that we only started giving them $100 a month of it when the pandemic started is absurd. We should have just never made it in the first place. And then we wouldn't have a fund balance to even talk about. But because we do, and because these workers are doing these jobs for no pay, when they could be good union county jobs for people with pay, let's just pay them for the jobs they already know how to do. I don't see any argument against that. Thank you, Judge.
Any other questions? Yes, Ms. Klein.
I don't know if maybe the solicitor has answer to this question, but is there any tax implication for the money that the people take home with them if they have leftover from the tablet or commissary fund?
I don't know tax, so.
Yeah.
Right.
Me neither, but I do know that even once we do pay them, they will only get to take 1/3 of their pay home to them. Their 2/3 goes to any dependents that they have at home, any restitution, things like that. Only 1/3 would actually go on their books or leave the jail with them.
Yeah, but it's not a matter of what leaves the jail. If they are paid employees, then there are tax consequences. Whereas we give them $100, that's a donation. That's a gift. That's not a payment. And the IRS taxes wage payments. And so whether they take it home or not, they're going to be responsible for tax consequences on the entire amount that they're paid. And I think that that's something that we would have to figure out, because obviously, if we're going to pay them, we're going to have to make arrangements for that tax to come out, which is going to,
And I think we have a great model for that because the state has been paying their workers. And even though it's an abysmally low wage that they're being paid, they, I'm sure, have dealt with the same thing. So I will take that upon myself to reach out to the PADOC and find out how they do that with the tax implications. That's not something I thought about, so thank you.
Any additional questions? All right, the next item on the agenda, Mr. Kostinowicz and I met, and he pointed out to me that per the statute that governs the Jail Oversight Board, we are required to provide a written report anytime there is a visit to the jail. Historically, board members have done visits, but they've just given an oral report during the meeting. Ms. Hallam recently visited the jail, and she is going to, so the point is, the statute does require that. Mr. Kostinowicz is correct. It does require that. And Ms. Hallam recently went and visited the jail, and while she is going to provide an oral summary of her visit today, she has graciously agreed to comply with the statute and provide a written summary that will be posted on the website. So, to respond to your inquiry. Any other questions regarding that? All right. With that being said, update on the discussion with the law department on the jail disseminating information to the board regarding county police investigation of deaths in the jail. Warden Harper, do you have anything you'd like to provide regarding that?
I do, Your Honor. And of course, we cannot give any information pertaining to any deaths to the board, but I do want to give the board a basic overview as to what takes place when a medical emergency is called. So the first thing that happens is when a correctional employee see an unresponsive individual, the correctional employee will begin CPR, call a medical emergency. When the medical team arrives, the medical team and the correctional employee will work together to do CPR until 911 arrives. When 911 arrives, or if the inmate is declared or the incarcerated individual is declared deceased, the area the inmate was discovered unresponsive is preserved for the county police to do their inspection, to do their investigation. The county police would do their investigation, and the jail will make notification to the inmate's emergency contact. And that's the contact that the individual has directed us to contact for emergencies. And then the jail will make notification to the Jail Oversight Board. So that's all I have to respond to that question, Your Honor.
Any questions? Mr. Pilarski.
Warden, if there isn't a contact listed, does everybody always have a contact, or is there times there's not a contact listed? Who do you contact if there's nobody listed?
So what we do is, when we cannot find a contact, we look for old incarcerations, Facebook, we talk to the county police, we try to get an emergency contact from any and everybody when we do not have a contact.
I'm assuming sometimes you find them and sometimes you don't.
Sometimes we find them, Mr. Pilarski, and sometimes we don't.
Okay.
Ms. Hallam.
Yes, Warden Harper, so the specific question was about the jail disseminating information to us as the board regarding county police investigations of deaths at the jail, and I don't believe you touched on that in your answer, so can you please respond to what you found out regarding disseminating information to us about deaths?
I think I said that at the beginning of my statement, that we cannot provide information to the board. I stated that.
Okay, but we do get information that a death occurred, so would you agree that there is some information that you can disseminate?
The information that I disseminate to the board is all I can disseminate. Anything further than that, Ms. Hallam, I cannot give any more information.
And why are you not able to give us any information after the investigation has been conducted?
Because of pending litigation.
So is there pending litigation involved in every death at the jail?
I'm sure that there is.
If I may, one thing. So I do know we talked about this last month, and the cause and manner of death would be public once the medical examiner's office is finished with any autopsy or anything like that. If the chairman would like, I could probably work with the medical examiner's office and get the cause and manner of death, since that information is public at a minimum, for the individuals who die in the custody or while they're in the custody of the jail.
I think that would be wise. I think that any information that we can get after the investigation is complete that would be of public record, I think is fair game, and I think that we should provide that.
Yeah, I mean, I know that the cause and manner is public once the medical examiner's office is done, so we can at least follow, but I can get that information.
Please do.
Can I just ask a question? Because I'm not a lawyer. I'm just a little confused about the fact that the reason we can't get information is because there may someday be litigation about it. And I just don't know the rules on that. I don't know if one of the millions of lawyers who are in this room right now could answer for me. But couldn't everything maybe someday you could be sued about? Like everything? So how do you, I don't know, maybe I'm asking this question wrong. If someone else up here could help me.
I'm not entirely sure he said that there may be litigation. I think in a lot of these cases, after the person dies in the jail, there is a wrongful death lawsuit brought. So, I mean, my understanding was that there is pending litigation, and so you don't want to talk about that publicly because that's part of, discovery, and you don't want to have your position spread all over before you actually litigate the case. So
yeah, I totally understand that. Once litigation is pending, you can't talk about it. But what the warden just said, and if I'm wrong, please correct me, but that even when there hasn't been a lawsuit filed about a death, he still can't tell us because someday a lawsuit could potentially be filed. Can she answer that? I'm interested.
I was going to say, she can answer, but I know there's a statute of limitations where they have up to 2 years to file in certain cases. I don't know specifically, but to every case, then maybe the two lawyers can answer, but I know there's a statute of limitations where any lawsuit could be filed. So as a practice, you don't talk about something that still may, they don't necessarily sue on day 1, they might sue on day 60, day 100. They have 2 years in a lot of cases as a statute of limitations, but they can elaborate on it further.
Right. I mean, I know the jail's being sued actively for things that don't have to do with jail deaths. I'm sure that a lot of the things that have been disclosed to us in public meetings of the board will eventually be brought up in some sort of litigation against the jail. I know it happens all the time. So what I'm asking is, why specifically is it litigation surrounding death that is preventing them from telling us anything? Couldn't they come here and say, I can't ever talk about anything because someday the jail might get sued and this is all open for discovery? I'm just wondering what is specific about potential pending litigation about death when no lawsuit has been filed yet.
Ms. Hallam, we've been advised by the law department. Oh, okay. Go ahead.
I would love to hear from Mr. Bachrach.
I don't want to get into it, but there's claims and there's a judgment. The likelihood of a claim with a death is higher, but the main reason is actually HIPAA, because HIPAA is applicable for 50 years after death. So they can't get into the details of somebody's medical condition or medical history, much beyond saying that they passed away. And the cause and manner of death, it's just not public information.
So it is not at all the threat of potential litigation, it's HIPAA.
No, it's both, but it's really HIPAA is probably the main reason, but with the death, the likelihood of a claim is much greater than most other things.
Okay, thank you, Mr. Bachrach.
Any additional questions? All right. Update regarding ADA compliance within the jail, Warden Harper.
So what I would like to say about ADA compliance in the jail is that if an inmate or incarcerated individual feels as though he or she needs an ADA accommodation, the incarcerated individual can either write an employee, tell an employee verbally, or place a request through the electronic request slip indicating that they need an ADA accommodation. Once we are notified that an individual needs an ADA accommodation, we will meet with that individual to try to determine how we can accommodate the individual. So that's what we do pertaining to ADA accommodations for the incarcerated individuals.
Ms. Hallam.
Yeah, I think we discussed at the last meeting, who is the ADA compliance person for the jail? You said you were going to find out from the last meeting and let us know today.
We don't have anybody specifically assigned to the jail. So what we do is any request that we get, we talk to our healthcare department, and together, healthcare and the jail administration, we meet with the individual to try to come up with an accommodation.
Okay, so is it correct that, does the county have an ADA compliance person?
We do.
Okay, so are you consulting with that person?
Not all of the time.
Okay.
Some of the time, if we need to, we can consult with them.
Okay, so my concern, and I know this has been addressed at previous meetings, so I'm kind of wondering if you could bring the ADA compliance person to a meeting, because I have some serious concerns about the tier system that was discussed earlier. And I know, everyone says it doesn't violate the ADA, but it just sure seems to me that based off of a disability, a mental health diagnosis, which is a disability, that folks are being limited rec time, actually to the point that it's in violation of the solitary confinement ban. And so I'm just wondering, if you can't answer that question, now 2 months in a row, could you maybe bring the person who could so that we could ask them?
I think that the answer has been answered pertaining to our compliance by our stats people and our DHA. You just heard the presentation.
I would like a legal opinion on that from the ADA compliance person.
She's not legal.
I mean, it's a law, so I'm just confused. I don't want to re-ask the same question again, I'm so sorry. But could you potentially bring the ADA compliance person who has a legal background in the ADA and how to be in compliance with it to come and speak with us and answer our questions, please?
I will look and see if she can make it. Yes, ma'am.
Okay, with all due respect, Warden Harper, you said that last month, and so I'm just wondering if you could do it for next month, please.
I will look and see if I can do that, if she will attend, ma'am.
Okay, thank you very much.
Any additional questions? All right, Warden Harper, RFP for commissary vendor, if you could speak to that, sir.
Your Honor, we are in the final phases. I know it's been taking a long time when it comes to the RFP for the commissary, but we're in the final phases, and hopefully we'll have it posted real soon. So I'm hoping by the next Jail Oversight Board meeting, we'll have it posted, sir.
Any questions?
Yes, I would just like to ask that we as a board get a copy of it.
When we post it, ma'am, it's public, so everybody will be able to see it once we post it.
Can you please send us an email letting us know that it's been posted, because I don't just check the RFPs every day.
I think I can do that. Yes, ma'am.
Thank you very much.
Any additional questions? Ms. Klein?
And then when the vendor is chosen, will we have the option to see the pricing list from the vendor?
When the contract is finalized, yeah, I think it'll be available to to all of us. So once it's finalized, yes, ma'am.
Thank you.
Any additional questions? All right, so I need to take a TV timeout. If you could give me 5 minutes, and then I'll pass on that. We'll have Mr. Konstanowitz step up, and he'll do the first public comment. If you could just give me 2 minutes. If anyone else needs a TV timeout, now's the time. Thank you. right, with that being said, I apologize for that brief delay. Ms. Hallam had an additional question regarding the commissary vendor.
Yeah, Ms. Moss just jogged my memory. I was wondering about, so I know we've talked a lot about money and how, the current vendor is charging more than they're allowed to for commissary, but I'm wondering if anything other than money and cost of items is going into the factoring of the decision to draft the RFP and to pick the person.
Since we're still in the process of drafting the RFP, I cannot get into the details, but we are trying everything in our power to try to reduce the cost, the commissary prices.
Oh, I totally understand that. I'm sorry. I'm not asking the same question again. I'm wondering if product availability or, certain types of products or making sure that the vendor is always able to keep all the products in stock or the packages that they used to be able to buy with key fee and they're not able to now. My question is, aside from the cost, are there other factors that you're considering, and what are they? If you can even mention a few of them, please.
I cannot mention anything that we're using for the RFP, but everything that you said is in consideration, ma'am.
Okay, thank you.
All right, thank you. We'll now have our public comments. Mr. Konstanowitz, you are up, sir. And as we previously noted, we'd asked that everyone do their best to limit their comments to 2 minutes, as has been the case in previous meetings, is my understanding. Thank you.
I'll do the best with 2 minutes, but Marion used to talk for 10 minutes at a time in previous meetings. I know I don't want...
No one's going to ever cut her off.
Right.
That's different.
Okay.
Except for tonight, because it's 2 minutes.
Good afternoon, okay? I'd like to talk about the jail Oversight Board being included in the administrative reviews of it when a death occurs at the Allegheny County Jail. And this is in response to statements that have been made by board members at different times that they have a lack of information about when a death occurs at the jail. So I'm making a recommendation. In the case of death, a jail oversight board member will be present at the ACJ administrative review and the clinical mortality review, and in cases of a suicide, the psychological autopsy. Okay, and what I want to use for that is the NCCHC standard MHA10 procedure in the event of an inmate death. What it basically says is the deaths of a mental health patient and those who commit suicide are reviewed to determine the appropriateness of mental health care, to ascertain changes to policy, procedures, or practices are warranted, and to identify issues that require further study. So the death review consists of these 3 different reviews: an administrative review, a clinical mortality review, and a psychological autopsy in the case of a suicide. So the important question here is, why can't the board be included in these reviews? Now, these are ACJ administrative reviews, okay? And I'd like to read to you that I think you're all aware of, which is the statute, from the statute regarding what information it should be available to the board. It states the following: the books, papers, and records of the prison, including but not limited to the papers and records of the warden and those related to individual inmates, shall at times be available for inspection by the board. So if we're talking about these reports, to me, and again, I'm not a lawyer, this matches up with what's in this statute. So the question is, why can't the board be present during these administrative reviews regarding a death? Do people, can I have a response to that?
It's a public comment, so it's not a question that necessarily the board has to respond to. It's a public comment, Mr. Konstanowitz, but we've heard your public comment, and we understand your concern.
Okay, thank you.
Thank you, sir. Nadia, forgive me if I mispronounce anyone's names. Nadia Narnor?
Hello. I am here as a community member. I am a community organizer, and I wanted to speak about decorum on this board and a lack of apathy that seems to be stemming from the whole conversation about the Allegheny County Jail. It seems that at the JOB meetings, it is okay to cut off a fellow board member near the end of a meeting and not have regard for what your fellow board members are saying. I hear people talking behind each other while other people are speaking. Meanwhile, we are not allowed to speak, and we uphold that. I just want to say that. In addition, there has been another death since the last time I've been here. I've watched these meetings for years, and it does not seem like much is changing. Please do not perpetuate the already disrespectful decorum that the community is seeing, because this is coming straight from the community. Not only is only 5% of the people in Allegheny County Jail serving a sentence, the rest of them are our community members. We are still tied to these people. For them to be imprisoned cuts off community values, cuts off ways that we can help each other. And I want everybody to know that the community. Lastly, I want to bring up the banning of said books that are deemed dangerous by Warden Harper. I can tell you that the public wants these bans of each book to be public knowledge. The public wants to know. Why is it that a John Lewis book was turned away from the jail? Meanwhile, our children read those books in school. Our children decide how they can behave in this society because of historical books like this, and our people inside are not allowed to read that. Please check your humanity in every book you turn away, because that is one of the only things these people have. In closing, the community sees disrespectful decorum, apathy to the welfare of the community members locked up and their families, and we can't even send books. Our tax dollars go to this facility. And I just want to say, it's not making communities safer with higher incarceration rates. It's ripping people away from their homes. It's ripping parents away from their kids, kids away from their parents, kids who have mental health disabilities and do not get the opportunity for that to be important. We're listening every step of the way, and I will be sitting here every step of the way. Thank you.
Thank you, ma'am. Thank you very much. Tanisha Long.
Hi, and thank you for your time, the very short amount of time we have to speak. I'll use it well. First, I'd like to say that I do not appreciate the creative redefining of things like a day, things like what solitary confinement is. I think that it's a ploy to take away the rights and to ignore the referendum, so I would like that on record. We know what a day is, we know when it starts, and we know when it ends. Your staffing issues are not our problem. But they are the problem of your staff and the people in the jail. They create medical problems. Your staffing issues are the reason that we now have a 14th name to add to the list of deaths that have occurred in the Allegheny County Jail in the last 2 years. Jerry Lee Ross Jr. now joins an unfortunate club of people who have died under Warden Harper's watch. And this man sits here as though someone has assigned him God, and he writes it off. He does not give us the answers. He does not give us the transparency. These aren't people falling through the cracks. These are people we're actively asking questions about, people we are actively seeking answers for, and we are not getting them. And my question is, what is the point of an oversight board if you turn a blind eye to the problems that are being brought up meeting after meeting after meeting? I don't have to be here every month. I would like to exist in a society where I don't have to come to jail oversight board meetings because we don't have jails, but right now that's not going to happen. But I would like to know that the people who are in there are at least safe until we can get them out. As Nadia had said, only 5% of people per your number, that's around 90-some people, are actively serving a sentence. So that means of those people in there, very few are people that a lot of people would consider criminals in a sense. Not that that matters to me. What I would like to say is that we're all one traffic stop away from becoming Gerald Thomas. We're all one probation detainer away from becoming Robert Blake. We're all one COVID case away from becoming Robert Harper. And these things are happening, and we're not finding anything out about them until long after they passed. Their families are not finding out in a timely fashion. They have to fight for medical records. this next of kin thing, which should be super simple. Anybody should be able to request to update their emergency contact list at any time, is apparently a problem. All of these things we've asked for time and time again, and I'll be here next month asking for it time and time again until something changes. I see more people on this board here than were here last week, and I thank you for your attendance, sparse as it may be. I am still waiting on Rich Fitzgerald to show up, even though I saw him leaving the building right before this meeting started, but thank you for coming in his place, illegal as that may be. So what I ask is, when are we going to start showing the care and concern that the families show towards their loved ones for the people that are there without choice? Thank you.
Thank you very much, ma'am. Now hear from Jonas Caballero.
Afternoon. Notice I did not say good afternoon because it is not a good afternoon. Nothing in this county can be good so long as our family members and our loved ones continue to die on the watch of Warden Harper. Nothing can be good so long as Rich Fitzgerald refuses to do his job and show up at these meetings to hear from his constituents. It is not a good afternoon when every one of you on this board have returned to your seats 4 weeks later and another human being has lost their life on the warden's watch. Every month, I am left to ask myself, why are any of you even here? Who or what are you exactly overseeing when people continue to exit the Allegheny County Jail in body bags? What's the point? You have already heard about the growing list of those who have died at the jail on Harper's watch, so I will address another important matter, which is the topic of food. On January 19th, Justin Troop, who is currently incarcerated at the jail, experienced a traumatic event, and I have Justin's permission to speak on his behalf today. Justin is described by his family as a quiet and friendly person, easy to get along with. If he's your friend, he's your true friend. He is caring, loves his family, and will do anything he can for you if you need help with anything. Well, esteemed members of the board, Justin needs your help. On January 19th, Justin discovered that a rat had been cooked into his macaroni and bologna dinner. The rat had been chopped up, but its hind legs and its tail were still intact. Justin immediately began throwing up and reported the incident to Sergeant Sunday, who personally witnessed the cooked rat and removed the tray and subsequently filed an incident report. Justin's aunt contacted the jail 2 days later and asked Sergeant Bosey, who confirmed that an incident report had indeed been filed. Both Justin and his aunt have requested a copy of the incident report, but they have been informed that the ACJ will not provide the report without a court-issued subpoena. Justin has been experiencing stomach issues ever since the incident and has returned to sick call on numerous occasions. Because he is afraid to eat the meals at the ACJ, he has resorted to purchasing the majority of his food through commissary, and as a result of the commissary's lack of basically anything with nutritional value, Justin says that his blood pressure has climbed dramatically. I know that some of you have visited the jail in the past, even bravely ate some of the food that has been cooked in the kitchen, which, as we all know, continues to receive citations from the health department. So maybe these couple of questions that I have will resonate with you. I have two questions. Question one, I ask on behalf of Justin Troop and his family. Can someone from this board please obtain a copy of the January 19th incident report and provide it to Mr. Troop and/or his family? Can I have a volunteer?
Next question, sir.
Next question. Question two, I'm asking on behalf of the other incarcerated individuals at the jail. I know that according to the ACJ Food and Food Services policy, it states that prisoners will be provided a diet that is nutritionally adequate for the maintenance of good health, and that a licensed dietitian will assure that they meet the recommended values. I am trying to find out who this dietitian is that is hired through Summit, who ultimately approves the diets and the menus that are at the ACJ. So if at the next meeting, if we could find out who the dietitian that is hired through Summit is, that would be a wonderful, wonderful thing to know.
All right.
Thank you very much.
Thank you, sir. Thank you very much. I apologize, but I cannot read this first name, but it's something with a B, last name Brown. So please forgive me, but I can't read your name.
Name is Bailey Brown. Thank you.
My apologies, I couldn't read it.
I'm here because I too am a regular watcher and attendee of these meetings for at least the past year now. I am consistently incensed and disappointed at the conduct of this warden, ACJ staff, and this board. I can confidently say these meetings are consistently the highest level of activation my nervous system experiences in a given month. You could cut the tension in here with a knife. I'm guessing that many of you would agree. And yet, nothing seems to be done. And I say this not to disgrace the good efforts that do come of these meetings. First, I wish to say that it feels crystal clear to me that hearing public comment is not being made accessible to all those who wish to participate, or certainly not a priority. And I am addressing you, Judge Housey. I work a normal 9-to-5 job, and it is a normal working Thursday today on which I was lucky enough to get out early, get here promptly in advance of the start time, and add my name to the speakers list. Judge Housey, I find your stickler for the rules approach, frankly, very frustrating. And I want to know what's up with it. For real. In particular, I'd like to cite the meeting of 2 months ago, where myself and others were here. We were not here at the beginning of the meeting to make the list, but we, I believe, advocated with proper decorum. Other than that we wished to speak. It seemed that the meeting was running ahead of time, and multiple members of the board or representatives sent instead expressed comfort with allowing us speak, and I am confident that were it put to a motion or a vote, that it would have passed, and you still did not allow us to speak, and I want to know what's up with that. And if I welcome you to address me at the end of this comment, any member of this board to address me or to meet with me.
Okay, being a stickler for the rules, you're past your 2 minutes, so you have to hurry up.
I was just going to say
Thank you.
that, frankly, I find that repressive because I don't understand why we're going back to this outdated standard. I don't understand what we're doing here, and as many others have just said, we don't want to beat our head against the walls month after month. There are clearly underlying concerns that are not being spoken in this room, and we are ready to talk about them. Thank you.
Thank you. Ms. Damick? Mr. Damick, can you pull that, Mr. Backrack, can you pull that mic down?
Okay, here I am.
Thank you, ma'am.
Yeah, very strange. As a matter of fact, when I'm here myself, I mean, I'm not representing any of the organizations that I've been I worked to or involved before. I'm taking this personally. I'm taking personally how the board is reacting, because I'm a Allegheny County citizen person. Everybody in this room, I would presume, is from Allegheny County, and all of you are. What do you know? What occurred to me recently, because it's been tax season or whatever, where you talk about money coming from the county. The money's coming from you and me and everybody here. Everybody in Allegheny County who should be able paying their tax to the county. That's where you're getting your money, and the most money for the county is spent on the jail. And I don't feel that you're giving the public the attention that they really. We have $1 into, we have money on the table. We're paying for your being here. I always want to, we're not paying the 3 people who are appointed by Fitzgerald, whom somebody else remembered, I've been here for many, many months, many years. I've seen him twice. I could go around the corner and see him, he lives there. However, that's sort of insulting to the people who are paying you for your work. Now, we're paying the warden also. I don't think you realize the warden is an employee. He has been hired by Fitzgerald and the county board. He's an employee. When you ask him a question, or when you ask for mostly this, for a number, and he says, I don't feel that the public should know this. I'll give it to you privately. Nobody says why. Why won't you give it? Because he doesn't feel that's what he said. He doesn't feel it should be. Is that how you would look at an employee? No. I don't know how you would look at an employee, frankly, but I wouldn't. If they don't want to answer something, I'd say, why aren't you answering it? If that makes sense, okay. If it doesn't, but you don't do that. You aren't asking that question. You're not realizing that the public, which pays everybody's salary, except the 3 people, is behind you. You're working for the public. And I hope to see you do some bitty work. Right today, though, the people coming up were excellent. It sounds very good. But I was surprised. 3 people have mentioned how you're acting, or shall I say, not acting. I thank you very much, and I hope you have good luck and good Cinco de Mayo today.
Thank you, ma'am. Thank you so much. We'll hear from Kevin Cordsey, I believe is the last name. Kevin Cordsey?
Kevin was with,
Oh.
he spoke already.
He was with Passages of Recovery. I'm sorry. My apologies. I see that. My apologies. I'll now read the public comments that were submitted. So the first public comment, and I'll summarize, is regarding the person that died in the jail. Persons indicating they're a county resident and taxpayer, and they have concerns about the job that Warden Harper is doing and the job that County Executive Fitzgerald is doing, and his failure to take these issues seriously. And that's a comment. I'll read this, now summarize the next comment. As someone who has never had to deal with the criminal justice system or the jail in any county, let alone Allegheny, I'm in pure disgust and outrage at the lack of zero treatment there is for nonviolent criminals with mental health diagnosis. Some of these diagnoses, are so severe that resulted in their arrest. Someone very important to me is a current inmate, completely missed psychiatric medications due to shortages in the jail or had them given way beyond when needed. He spent 4 days in isolation on the mental health pod for asking for his medication, reached out to his caseworker and psychiatrist to receive help. Worst part is jail doesn't offer help to inmates with mental illness, and person is indicating a concern regarding these issues. I don't know if that's something you care to respond to or address, Warden Harper?
I do want to respond, Your Honor. All alleged issues of this nature do not have to wait until the Jail Oversight Board to be brought to our attention. There are several mechanisms that can be utilized to advise the jail of any urgent issue pertaining to our incarcerated individuals. This comment does not even give us the name of the individual so we can research to see if we can do what we need to do to take care of this individual. So I just want to make sure that everybody know that the number that our constituents can call is 412-350-2000, and or they can send an email through our website, by clicking contact to send the message.
If I might, I'm going to read the next one, and if you don't mind. The next comment is, so many families in the community, are affected by mental illness. Person wants to thank the warden for recognizing that the ACJ has a large population of people with mental health conditions and for the training that he's provided to staff regarding mental health issues to improve interactions with those people. The October report says that there are only a few mental health specialists and one psychiatrist. Doesn't seem like there's enough people to provide counseling to the mental health population. Is it possible to train support staff, counselors, guards, and volunteers to provide inmate therapy either at the jail or by phone, is the comment. I don't know if you care to respond to that comment, Warden, and then I will allow Ms. Hallam to ask her question.
I would like to respond, Your Honor. We have conducted trainings at the ACJ, and we continue to look for qualified mental health specialists and mental health professionals to work at the ACJ. We just recently had a virtual job fair, and if anyone knows anybody that's interested in working at our facility, please have them submit their application. That's all I have, Your Honor.
Ms. Hallam.
Yeah, Warden Harper, do you, or at least someone, not you personally, at the jail, respond to every call and email that come in with concerns?
We do have a person that responds to all emails, and we do have people that answer calls so we can respond to these calls and emails daily.
And is there a voicemail associated with that phone number for people who can't get through when they call?
We do have voicemail capabilities, yes, ma'am.
And how often are you checking the emails and voicemails, and like within what time frame would you say you're getting back to folks who reach out via those methods?
Normally within 24 hours at the most.
Okay, so every single person within 24 hours?
We try to get to every single person. I'm not saying that we do, Ms. Howland. We try our best.
Okay, thank you.
Any additional questions? All right, there is an additional comment regarding Torrance mental health issues. I realize that Ms. Madden gave her summary, but I don't know that this comment was addressed. So often, people who work within the system understand these terms and these different institutions and what they are. This person has an inquiry or a comment basically indicating they have no knowledge of what Torrance is. So I don't know if you care to just briefly discuss what Torrance is and why that always comes up in our meetings, if you don't mind. Briefly.
So Torrance State Hospital is where patients would go. So if a patient has a court-ordered competency evaluation, which is done by a psychiatrist, they could be found incompetent to stand trial, meaning that they don't have a rational or factual understanding of their charges. So they would receive a commitment to Torrance State Hospital. There's a commitment hearing before a judge. And then, so the difference is that Torrance they offer specific services related to competency restoration versus the jail where we care for symptomology. So they have that ability to address competency beyond us. Once a patient reaches restoration, they may return to ACJ, then they can move through the court proceedings, discharge planning, and be released. Or sometimes they're released directly from Torrance to like a variety of different treatment communities from there.
Just another question, given the tenor of this question, the tone of this question. What would be the average stay? And I know that's a loaded question, but typically, what would you expect someone's length of time to be in Torrance? And I know that varies.
Yeah, it really does vary. It could be months, but it varies.
Okay, but no one is sent to Torrance to serve a sentence. They're there for psychiatric treatment regarding an issue related to competency. Is that a fair statement?
Yeah, they would go for competency restoration.
Any additional questions? Yes, ma'am.
I just have one, again, going back to this question. Can you speak specifically to what services and treatment, anything like that Torrance is providing that we can't provide at the Allegheny County Jail?
So I don't want to speak for them, but just my understanding would be that they can do anything that's related to competency restoration, which we don't do.
Are we not able to, like, are we not allowed to do that in the ACJ? What is the reason why we're not able to do it?
We just treat symptomology at the jail, and then they would go to Torrance for competency.
Okay, thank you so much.
So if I may, I think the point is, whenever a person has issues or there's a concern about their competence, a behavioral clinic is ordered, an evaluation is conducted in the jail. If they are deemed to be incompetent, they will be sent to Torrance for treatment and efforts to restore that person to competency. And if that does happen, they will then be transferred back to the jail to participate in the process of resolving their charges. In the event that they are not restored to competency, there are a number of things that can occur to address that person's needs and or to resolve that case. Is that a fair statement?
Yes.
Does that address your answer? Yes, ma'am. Yes, ma'am.
Is it fair to say that the only mental health facility we have in Allegheny County that we use is Torrance?
Through the jail, yeah, Torrance would be the state hospital that we use, yes.
Okay.
Yes, ma'am.
And so that, excuse me, and so that's probably the reason that they're on the list so long here to get admitted.
Yeah, Torrance takes people from other counties as well.
Okay.
Yeah.
Thank you.
Thank you. My apologies for cutting you off. Yes, ma'am.
Thanks. So the first thing is, who orders the behavioral assessment? Is that the judge?
Yeah, so court ordered, yeah.
Okay, and then the second question is, I was under the impression that there were people serving sentences at Torrance. Is that not the case? Has no one been sentenced and is there?
No.
Well, they may have a probation sentence that they're serving when they pick up a new charge, and then they go up on a new charge, or they even go up on the probation violation. If they can't understand the legal process, then we can't proceed with them. So we have to assess their competency, find out if they can understand what's going on, and if they can't, they go to Torrance. So some of them may be people who have a probation violation who come back to the jail, and they have mental health issues at that point, and so we can't deal with them until they are competent, because we can't do anything legally if they don't understand it.
So I'm just concerned if they're not serving like a time period sentence, and what if they never become competent by the assessment? They stay in Torrance for forever?
No, we cannot, first of all, we cannot deal with any case if the person is not competent. We can't proceed on that case. So a lot of people that go up pre-trial, if they're determined to be not competent, then their cases will ultimately be null prost and dismissed.
And they go home?
And, well, they may not go home. They may go to an LTSR, a locked treatment facility for people with mental health issues. They may go to a CRR, which would be a community setting. It sort of depends on where they are. So we will try to make sure that people will make sure that they aren't just sent home so that they're not being treated. They will make sure that they get into a place that's safe for them and that they will receive treatment. But then their cases will be dismissed, okay?
Okay. So when they're dismissed, do they go home? I'm just wondering how you go home after you've been sent to Torrance.
They may go to a place that will help them better than home. For some people, home is not the safe place. For some people, home is not the place to go because they'll continue to decompensate and they will hurt themselves. So for some people, they will go to a treatment facility that will help them, and once they're helped, then yes, they may get home.
Okay, but they are going to those places without a conviction because they don't need it to go to those places, correct?
They're going there for their own health, safety, and welfare, yes.
Based off the behavioral assessment. That was what I was trying to understand.
Based off of their time at Torrance. I mean, when they get to Torrance, they're there for some period of time, and they determine that they're not competent and aren't restorable to competence, then we try to make sure that they're in a safe, good place where they'll be well taken care of, treated, and go forward. Some of those facilities are locked, some of those facilities are not locked.
Okay, thank you.
Any additional questions?
And thank you.
Any additional? Thank you, ma'am.
Yep.
Any additional questions?
And you need to understand, I think there's only 2 state hospitals in the entire state. So we share Torrance with a bunch of other counties, and there's only so many beds available. So that's what results in the delay of getting people there. It's not the Allegheny County Jail's delay in sending people. It's the fact that Torrance only has so many beds and has to spread them out between Allegheny County and a substantial number of counties in the western side of the state. Okay?
Thank you. Another comment was there was a concern about medications not being delivered in a timely manner. What are the options that the jail is exploring to address this delay? Is there an option for giving inmates medication earlier in the day so that it could be passed out when it's time for them to be delivered? Essentially, what options has the jail explored to ensure that incarcerated individuals are getting their medication in a timely fashion?
So, Your Honor, we have continued and we reviewed many options to include the suggestion from Mr. J. But the nurses preparing the medications have to make sure that they're within the regulations when they're doing these different options. So we just got to make sure we're following guidelines when we're doing this. So we have considered different options.
Ms. Allen?
No, I've asked this question a million times. I'm not going to ask it again.
Any other questions? All right, lastly, what type of programming is offered by the jail to inmates in segregated housing or inmates which are on disciplinary status? What kinds of programming is available to inmates on the mental health pods?
So both our segregated and our mental health inmates are offered GED, reentry services to include parenting and thinking for change. The inmates, the incarcerated individuals in our mental health units, they have to be approved by a doctor in order to participate in these programs. So they are offered those programs.
Any questions? All right, with that being said, Warden, if you could provide us with your warden's report.
So the first thing I would like to report to the board is this week is Correctional Employees Week, and correctional professionals throughout the world is celebrating our profession. So we've done several things to celebrate our profession. This week at the jail, we've had a steak day, we had a memorial service yesterday, we had an ice cream day, donut day. We're just trying to do everything to celebrate our profession. So the next thing I would like to talk about is full recreation. We're proud to announce that we've implemented full recreation at the Allegheny County Jail, and full recreation began Monday, May the 2nd. I would like to get into the book issue. So I want to inform everybody as to what books are not permitted into the facility. Hardcover books are not permitted. Books with plastic or wire bindings are not admitted. Books containing pornography, sexually explicit material, or nudity is not permitted. Books that advocate violence is not permitted. Books pertaining to weapons, firearms, ammunition, or directions for making explosives are not permitted. And books deemed to compromise the safety and security of the facility is not permitted. Now, I've got a couple more jails to talk to pertaining to their book policy. I will have this posted on our website so that everyone can know exactly what books are permitted into our facility. And the last thing I would like to announce to the board is election for our incarcerated individuals. 27 incarcerated individuals have expressed the desire to vote in the primary election. Absentee ballots will be accepted until May the 10th, and voting at the jail will take place on May the 12th. Your Honor, that's all I have for the board.
I have a couple questions, but I'm going to work backwards. So when you say 27 folks express interest in voting, does that mean that 27 filled out absentee ballot applications?
Yes, ma'am.
Okay, and then you say, what was the 10th and the 12th? Because my understanding, I mean, I voted by mail, you just kind of fill it out and then put it in the envelope and give it back. Do you do a different process in the jail that you have a dedicated day for voting? And if so, what does that process look like?
So requests for the absentee ballots will be accepted on the 10th. So then we would take those ballots to the elections department, and the elections department will come to the jail to do the absentee ballot process.
Okay, and then they leave with the completed filled out ballots when they leave the jail. Okay, great. My next question is, and again, I'm going to get into this a little bit with my report on my visit at the end, but so you talk about the books that are being banned, like allowed into the facility to be mailed, and I'm specifically wondering about the books that are available on the tablet. Did any rules governing what books they're what type of books they're able to use on the tablets change?
Not to my knowledge, no.
Because I spoke with multiple people who, showed me I was able to get this book last month and now I'm not allowed to order it anymore. And there was like 20 books on one person's tablet that he had read less than a year ago that he was unable to access again. So I was told that these changes kind of happened at the same time that and it might be an absolute coincidence, but that the commissary and tablet accounts became linked. So I'm wondering if when that started happening, did you maybe change libraries of books that were available on the tablet?
Ms. Hallam, I'll have to get back with you on that.
Okay, thank you.
If I can, just, Ms. Toma, I think you were raising your hand. Can you, Deputy Ward, can you answer that question? Are you able to?
Yeah, thank you.
So our tablet program for the books is Overdrive, and we have a subscription with the publications, and they vary. So they may be by checkout, they may be by a time period for which we have that book available to us. So we are actually in the process of updating all of those for which either the checkouts have expired or exhausted, meaning we only get 20 checkouts, or the time period from when we subscribe to that particular book with unlimited checkouts has expired. So we are actively increasing those and renewing those at this time.
Great, thank you so much. And then my next question, Warden Harper, sorry, I literally have a million things here to ask you. Okay. Okay, next thing is, so in regards to the referendum, and I know that we could talk about this all day, just you and I have a blast with that, but I'm wondering if, aside from the reporting, is there anything else that you're doing differently, you or your officers, since the referendum passed? Like, how are you approaching solitary differently? How are you approaching lockdown and rec time differently, aside from just the reporting mechanism that is required?
We're not doing anything differently, no.
Great. Okay. Next, my question is about, so I've heard that when Chief Deputy Zetwo left, he wrote a report about things within the jail throughout his experience that needed addressed. Are you able to share that report with the board? I think his expertise would be very valuable to us as oversight members.
I don't know anything about a report like that. I'm gonna have to research to find that out, so I will have to get back with you about that.
Okay, are you saying that you never received anything from Chief Deputy Zetwo on his way out?
I'm saying that pertaining to the request about issues with the jail, I don't recall that right now, and I would have to research to find that out.
Oh, it's fine. I can get it from him. I was just wondering if you would provide it to us, but I can get it if you don't know about it.
I will have to research to find that, ma'am.
Okay, we can do that together. I appreciate that very much. Next, I guess a lot of my other questions might come after my report at the end, but at least one more question. So I know we talk a lot about, you talk a lot about your respect for the officers at the jail, and how this week is Corrections Officers Week. And so, unfortunately, Union President Brian Englert was not able to be here today because he has been disciplined for coming to our meetings on union business instead of starting his shift at the scheduled time, so he's not able to attend and speak to us anymore. One of the reasons why I had hoped that we could get a report from him prior to each meeting. But specifically, he had asked just that I refer information about Corrections Officers Week, and since you brought that up, I thought now was pertinent. They're still waiting on a sign-off for new uniforms, and as of now, he has compiled 120 complaints from officers about the lack of access to uniforms. And so I'm just wondering, I know we had talked about it at previous meetings, has anything been done to change the status of access to uniforms for the officers?
I just want to say to the board that everybody is having supply and demand issues. And not just, the uniform vendor that we have, but other uniform vendors. So right now we have a contract with a particular vendor, and we're going to stay with that vendor until the supply demand is taken care of. Everybody is running into supply and demand, Ms. Howell.
Okay. One more thing is, I know you talk a lot about staffing issues, supply issues, things that everyone's experiencing right now, but specifically, I know that you've talked a lot about the reason we don't have additional open pods is staffing. And so what I'm wondering is, how many folks are at the ACJ right now waiting to go upstate? Like their 300B or whatever that document is comes in and they're ordered to go upstate. How many of them are housed in the ACJ currently?
I don't have that number right now, ma'am.
Okay, could you, in future meetings, bring us that number? I just think it's important to see where can we cut down on population, and I'm just trying to figure out where that bottleneck is.
Yes, ma'am.
Could you bring that?
Yes, ma'am.
And then also, one last thing before we move on to the Chief Deputy Warden's report is you had told us at the last meeting that you were going to bring a legal opinion from your legal department or the county's legal department regarding your compliance or truly lack of compliance with the solitary confinement referendum. I didn't receive that before the meeting, and I talked to a couple other board members and they didn't as well. Is there a separate thing that maybe wasn't on the agenda where you planned on sharing that?
I think at the beginning of, first of all, we are compliant. You
No,
said
you're not.
lack of compliance. I want to make sure I correct you. We are compliant. And I think at the beginning of this meeting, we had a presentation from our county stats and DHS stating that the county believes, in consultation with our law department, that we are compliant. So that's my statement. We're compliant based on the county and our law department. That's what they state.
With all due respect, Warden Harper, that was not what we asked for and what you had agreed to bring to us. It was a legal opinion from your legal department saying what you claim to be true, that you are following the referendum. We got some great information from that presentation earlier, but they were not here to argue that they are that you are in compliance of the referendum. They were simply giving us the data on how they compile the information. And to be honest, it gave me a lot more ideas how you might be further not in compliance. But I'm just, again, I don't want to go into that. I truly just want to know, you had told all of us, every single member of this board, when you were here last month, that you would bring us that legal opinion. Did you bring it?
I did not bring that legal opinion, but I did bring DHS and county stats here to explain the process in consultation with our law department. So I will not be providing a legal opinion, Ms. Howell.
With all due respect, I mean, it's wonderful to find out how you're compiling stats, but we would really like to hear from the Allegheny County Law Department as to whether the law department believes that there is compliance. And it's been promised on multiple occasions, and I would very much like to see that as well. I was sort of expecting to have it by today, and it would be nice to have it for the next meeting. There are members from the law department here, so maybe we could make sure that there is something prepared in writing that we could review prior to that time.
Your Honor, I will see if I can get that, ma'am.
Thank you.
Ms. Hallam, you had additional questions? Forgive me, Ms. Klein. I didn't
No
see you.
worries,
My
no
apologies.
worries. Yes, I'm just going to echo what they said, and I think in particular to ask for a legal opinion on solitary, whether that's single cell or whether someone has a cellie, does that still qualify? Because that seems to be a discrepancy in definitions.
Thank you, Ms. Klein.
Yeah, and Judge Halsey, if I could just add it all, just to kind of get your conversations going. So I actually have the section outlined that clarifies Ms. Klein's question. I just thought maybe I'd get you started. So in the Administrative Code of Allegheny County that applies to the county's referendum, it specifically says that if a word is singular, it is also construed as plural. So everywhere in the referendum that it says inmate, despite me not being a fan of that word, but everywhere that it says inmate, it should also be construed as inmates. I know that was an argument in a previous time, so I'm just gonna give you a heads up on that. It's section 5-101.04. So for Mr. Baccarat and your team, Warden Harper, if you just wanna add how you are construing that to mean something else, that would be helpful. But again, please, I just wanna reiterate, it's not like we're kind of asking at this point. We were told we would get it, and we have not. So I would appreciate if you did bring that to the next meeting.
Ms. Hallam, you also indicated that you had additional questions. I would ask that you ask those questions now, because when you give your report, that is just a summary. That's not an opportunity to ask the warden additional questions.
Sure then. So one of the first questions I had is, so when I went on my visit, one of the pods I went to was 1C. And so the folks on that pod had specifically expressed a desire to have menstrual products that were more absorbent than the ones that they were given currently. They're currently given like super thin tampons and short pads. But yet, earlier today, I was actually informed that that was happening and that was actually ordered the day before I was there. So I'm wondering, how did that decision come to be to supply more absorbent menstrual products? And will they be supplied on the pods of any pod that has someone who menstruates, or only the pods that are specifically identified as female housing pods?
The issue was brought to our attention about those hygiene products, and when it was brought to our attention, we acted on it.
Okay, that's awesome. I only wish that everything we brought to your attention happened that fast, because I'm really pumped about that specifically. The next thing is, another thing that I heard over and over and over again was that they want their 12-step meetings back, NA and AA meetings. Is that part of the, rec being full now? Are NA and AA meetings being offered again?
I will look into the AA and NA, but one of the things we got to realize is that COVID is still here, and we've got to come up with a process in which we're not going to mix incarcerated individuals. So I will look into that.
Okay, great. Another thing is, so there used to be a $175 limit per commissary order that the incarcerated folks could spend, and now it's gone down to $150, and I'm wondering if you could speak to why and what we would need to do to raise it up again.
$150 is too much commissary for an individual to order and store in their cells. So I feel as though $150 is too much because the amount of space that we have in the cells, so I really think that's too much for the incarcerated individual.
Have you yourself ever had to rely on commissary as your only food for the day?
I have not.
Okay, so I with all due respect, I don't really think that your opinion on what is too much commissary is what we should be following here, especially because one of the other things I saw was how many people are not eating the meals provided at all because, oh my God, can't wait to get to my report and tell you guys about the food they were serving when I was there. But a lot of people are only eating commissary, so I don't think that $100, $150, $175 is too much when that's all they're eating.
Well, I disagree, and right now, I feel as though $150 is suffice, so we can definitely talk about it, Ms. Allen.
Okay, and can you tell me who set that limit?
I did.
You personally, okay.
Can I just, if I may follow, I mean, I think what I'm hearing, if I hear, it's not necessarily the amount of money. There's a limited space where they can store stuff, and then it becomes a possible safety or security issue because of the limited space inside a cell.
Safety and security issue inside the cells. Everybody's talking about rodents. The commissary left in the cells, open, brings rodents and everything. So it's a safety and security issue all the way.
It's more about limiting the number of products, not necessarily the amount of money.
It's a combination of everything, Mr. Paul.
Okay.
Okay. Thank you for that. I mean, that actually brought up a great point, is I could, just never eat any of my commissary and buy it over and over again, no matter what the limit was. So how does what they're purchasing each month, maybe some people are eating it, some people are stocking it, and I don't think the rats in the food is coming from their cells. It's probably coming from the kitchen where the food was prepared, right, Warden?
I have no comment.
Okay, a couple more questions. So I know we had brought up at a previous meeting, I actually don't think it was last month, but a couple previously, about the money that they're supposed to be getting for vaccines. The $25 for every shot, booster shot. Almost every person I talked to told me they definitely didn't get it for their booster, and some of them didn't even get them for their shot. I think it was still when Chief Deputy Williams was here that she said that she was making sure that was happening. Can you make that happen, please? Thank you.
We'll follow up.
Okay. And then another thing is, there are, I talked specifically about like the pods I visited. So the one pod I visited, I spoke with a woman who overdosed the week prior, her and her cellmate. And the consensus on this pod was that new courts, folks who are coming into the jail fresh from the streets or wherever, should be separate from people who have been in the jail for a while, because what's happening is they're the ones bringing in the contraband. They're, these folks who I talked to saw that as kind of a, like kind of rubbing it in their face. These people are coming in off the street with drugs. They've been in this jail for a year, haven't seen any drugs, and now they're tempted. Totally, as someone who used drugs for a lot of my life, I totally understand that. And so I'm wondering, what is the rationale for mixing new courts with people who have been on a pod for a long time, especially whenever those folks who have been on that pod are saying that this is bad for us, it's causing overdoses and bad things to happen? Why don't you separate new courts?
Right now, I have 2 pods of female incarcerated individuals. and female incarcerated individuals coming into our facilities approximately is very minimal. So I don't think that it would be appropriate for me to open up a whole pod to house maybe 6 or 7 incarcerated individuals, especially during this time period. Now, that may be something that we can look at in the future, but right now, I cannot do that.
Okay, and the reasoning for that again, this time of year as in spring or May?
I'm not going to say when, ma'am, but it's something we can look at in the future.
No, I'm sorry. I was trying to understand why, especially not at this time of year.
That's something I'm not going to talk about in this public setting, Ms. Howland.
And what is the reason for that?
You have another question?
I didn't get an answer to my last.
He did. He said he's not going to answer the question.
Okay.
So you have another question?
Sure. So another thing is the incarcerated folks, the motion that we approve every month for $100, they are 1 month behind. There was a month that was missed. I heard it from different people on different pods. So they said they usually get it on the 3rd Wednesday of the month around that time after we approve it at the beginning of the month. So I'm not making any accusations. I'm just asking if someone could please look into it and catch them back up so that they're on the right track. But multiple people said they couldn't tell if it was January's or February's that was missed, but they were missing one.
We could look into it, ma'am.
Okay, thank you very much. And another thing is, could you just one more time, since this is my last time I get to ask you questions, could you give us that phone number and contact email address that people can reach out and directly ask the jail questions and concerns?
412-350-2000.
And the email, please, Warden.
Go to the website, and on the website, we have a place that says contact. Click contact, and it will bring you to the message board where you can send an email.
Okay. And I think that's it. If I think of anything else, I'll let you know. But thank you so much.
Chief Deputy Warden Beeson.
Thank you, Your Honor. I'd like to start out by echoing Warden Harper wishing the dedicated men and women of the ACJ a happy Corrections Employees Week, and I also thank them for their service. Happy to report that mental health first aid training in conjunction with the Department of Human Services has completed, and we have trained 659 individuals in mental health first aid training are now certified, okay? Since the last board meeting, there have not been any promotions, but I can forecast that this coming Monday, May 9th, and since he's in attendance in the audience, Mr. Joel Robbins will be onboarded to the facility as a sergeant, so congratulations, Sergeant. We currently have 10 cadets in the Corrections Officer Academy. They're slated for graduation on June the 24th. Over the last 2 weeks, we've held 10 separate physical agility tests. We had 81 applications for that physical agility test. 38 participated, meaning we had 43 no-shows. Of the 38 who participated, 8 failed the physical agility test, leaving us 30 potential candidates. From the 30 who passed that test, 4 of those have failed background clearances, leaving us 26. So I have 13 of those have passed clearances, 13 are pending, and then once they clear the background check, they move on to being invited to the REACT written exam. And we're anticipating the next supplemental cadet class beginning in early July of this year, 22.
If I may, did you change up the order of the process in your application process?
Yes, sir, we did. Traditionally, we used to do the written test first, meaning the REACT test, the online test, and then once they passed that, then they would show up to the facility for the physical agility test. So now we put the physical agility test in front of the REACT test in hopes of getting some investment from the candidate, saying, you know, if they're going to show up to the facility, if they're going to run the stairs, if they're going to sweat, if they're going to go through all that, then hopefully when they pass that, then they're going to take that next step and move forward through the process. So.
How long ago did you begin that?
That
approach?
It's probably a few months ago. It's fairly recent.
Okay, so it's still too early to tell if it's actually working. Well, other than the fact that people are taking the test and still showing up.
I can definitely see an improvement in the numbers, an increase in the numbers that we've had at least apply. So I'm hopeful we could have a full cadet academy coming up for July. So.
If I'm understanding, some of the no-shows, like if they called and gave a reason, they're given another opportunity to take the physical agility test? I think I heard.
Yes, sir. So, Mr. Pilarski, we had several So one candidate had a death in the family, one is out of country, who's active military service, they're going to be returning. They reached out to HR, we did reschedule those. We have 4 additional cadets showing up next Thursday, I believe, to also participate in that agility test. So we're trying to get them in.
So in speaking with a bunch of different officers, I have realized that one of the biggest hurdles is actually not just like the order that things happen in the hiring process, but also that I might start the hiring process now and not actually have a job or an offer for a job for months. And so I'm wondering if you all have figured out, and I can understand that I don't want to wait 4 months to start a job. Have you all figured out a way to streamline the process? I understand reversing the order to retain more applicants, but have you thought or figured out a way to streamline it?
So the duration between the stages has definitely compressed what it used to be.
Okay.
Because we were made aware of the same frustrations. We would do the written test, and then it would be several weeks or a month later before they were invited to do the physical test. So that timeline has drastically shrunken.
Okay, great. And then also, since we're talking about staffing specifically, I mean, this list is all the healthcare staff vacancies. Like, that's a lot of people. I didn't even do the 67 and a half, just healthcare vacancies. That's not even including officers. And so, I'm wondering, again, I saw it with my own eyes, but I'm wondering, is there a separate plan that you have for recruiting and retaining healthcare workers? Because it sounded like the process you were talking about had mostly to do with officers.
We just had a virtual job fair, and the virtual job fair has actually helped us recruit a lot of individuals. We've also reached out to our agencies, and the agencies are starting to provide us more LPNs, nurses, and healthcare staff. So next month, you should see a lot of those vacancies filled because of some of the efforts that we're taking to fill those vacancies, especially with the healthcare staff. You'll see those vacancies shrink next month.
Great. Do you have a number on how many people you were able to recruit from that virtual job fair?
I do not at this time, no.
Okay. Thank you very much.
That's all I have, Your Honor.
All right, so I just want to, before I do this healthcare report, I just want to clarify something I said earlier about staffing when you asked me about the behavioral health providers. So none of our advanced practitioners are actually employed by the county, they're contracted. Just wanted to, I apologize for that. And also in regards to the tiers, when you asked about tier 5 being the only one with limited out of cell time, tier 4 is also included in that, so. All right, so the total amount of incarcerated individuals tested for COVID-19 during April 2022 was 1,686. Of those, 19 or 1% were found to be positive. There are 10 incarcerated individuals presently positive in the facility, and 0 are hospitalized from COVID-19. We have had an overall positivity rate of 1.4% at the Allegheny County Jail since the first diagnosed case of an incarcerated individual on April 6, 2020. For employees, throughout the pandemic, we've had 254 staff report positive results. We presently have 2 individuals who continue through the recovery process and have not yet returned to work. For vaccination updates, in total thus far, the Allegheny County Jail has supported the vaccination of over 2,662 incarcerated individuals and has provided over 539 booster vaccine doses. On site, we have stored Pfizer, Moderna, and the Janssen vaccine. We're continuously offering these vaccines. Last month, we reported we had 802 individuals who had received their full series. This month, we have 647, which is 42% of incarcerated individuals that have completed their series. For medications for opioid use disorder and the expansion of these efforts, the jail continues to provide medication-assisted treatment for opioid use disorder and alcoholism by offering medications including naltrexone and Vivitrol for the treatment of alcohol and opioid use disorder, as well as Suboxone and Sublocade for the treatment of opioid use disorder. For the month of April, there were 30 individuals prescribed oral naltrexone, one of which was released into the community, so they received their Vivitrol shot prior to leaving. During the month of April, 93 individuals were treated with Suboxone and 13 were treated with Sublocade, totaling 106. The ACJ continues our contract expansion for methadone treatment with Tediso, who's our methadone provider. We're actively developing the implementation of those methadone services. This would be for continuation for individuals coming into the facility, and we do not have an implementation date that I can report yet. For Torrance commitments and admissions, during the month of April, 9 patients were admitted and transferred to Torrance State Hospital. In April, 10 new patients were committed to Torrance State Hospital, and there are currently 10 patients who are awaiting admission to Torrance State Hospital on the wait list, with the longest waiting individual since February of 2022.
Any questions?
Okay. First of all, and I don't really even think this one particularly is your problem at all, but I'm just wondering why we never get to hear from the medical director here. I know we have like a lot of other folks in different departments and positions.
Because the medical director is employed as an AHN employee, and we feel as though that our HSAs and our deputy HSAs can answer all of the questions pertaining to our healthcare department.
Okay, never mind. And then the next question is, so you talked about, like folks with opioid use disorder, substance use disorder. So there used to be some kind of like substance use disorder program, like a drug and alcohol program that they would like leave the pod and go and do. It was like a thing, and now it's just packets under the door, due to COVID, of course. But my question is, and if you don't have anything to do with this, I'm sorry for asking you, but do you have anything to do with that programming and like when it's going to return?
So for substance use programming on the pods, yeah, we're working on that now, but I don't have a date to give you.
Okay, but it is like in the works. Mm-hmm. Okay, great. And then one last thing about the things you were talking about is specifically how are folks' medical situations being handled in intake? Like, is there always medical staff in intake, especially when it comes to like providing MOUD? Do people ever get MOUD in intake, or are they just going through withdrawal and then hoping to get it when they get upstairs?
So okay. Yeah.
I'm not really sure how to answer that, but I will say this. There are situations in which, people use approved leave, and we don't have, healthcare staff down in intake at some times on some shifts. So I just wanted to clarify that. And if our medical provider deemed that it's necessary for MOUD, we will provide it down in intake.
And I just want to know how you find that out before they go through their medical evaluation, because if they got their medical evaluation, they'd be upstairs. So how do you find that out when they're in intake?
So we have a program down in intake called Short Script that tells us exactly what medications individuals are on in the community. So we review that and we provide it to our providers to determine whether or not, to continue them on it. So everybody coming into our facility, Short Script is reviewed to see what medications they are on in the community.
Okay, and last question, I promise. When can we expect, I know this is another thing that's seemingly been in the works for forever, but when can we expect, and there's a medical term for it that I totally don't know, but putting people on new prescriptions of MOUD? Like they didn't have it on the streets, right, and they come into jail and you start the prescription. I know that's in the works. When can we expect that?
Yeah, for initiating, yes. You mean? Yeah. I don't have a date for you right now. I'm sorry.
But you promise me you're working on it?
We're working.
Okay, thank you so much.
Yes, Ms. Klein.
I just want to say I'm so happy that your MAT program is up, and congratulations, and I look forward to hearing more good stuff about that. And maybe Mr. Pilarski can answer this question. Do we have a specific contract with AHN to supply the jail with 2 psychiatrists? Because it's kind of, I know that I'm just personally, contract with AHN to provide medical providers, and we know the jail is full of people with mental health disorders and distress, and that we're down 2 psychiatrists.
If I recall, when former Chief Deputy Warden Williams was here, she mentioned that being a very difficult job to fill across the country. If I recall, about the same thing. So I don't know the specifics of the AHN contract or what that calls for, but I do recall previously them talking about how difficult it was, not just for us, but for everybody to fill those type of positions.
Oh, I know that where I work, we can't get nurses, so I totally understand that. But I would just like to put out that if there's any way the county has any way to, if it's a contract issue or.
Well, Ms. Klein, I just want to say this. We are in the process of interviewing, so we should, in the next report, you'll see some of those vacancies filled. So we're in the process of interviewing psychiatrists.
Thank you. And my last question, well, it's a request, is would it be possible to include the number of Tier 4 and Tier 5 classifications on the reporting system if it wouldn't be too burdensome in your monthly report?
We'll look into that, Ms. Klein.
Okay, thank you.
Thank you very much. That being said, new business, Ms. Allen.
You want me to start with a visit or start with a motion?
We would like to follow the agenda.
Okay. All right. So I would like to make a motion to request money from the Incarcerated Individual Welfare Fund to be put on the joint tablet commissary accounts of each person in the ACJ. At the time that I did this, there were 1,550 folks incarcerated at the jail, $100 for each person, total cost of $155,000. I would like to motion to approve.
Seconded.
All in favor?
Aye.
Aye.
Any opposed? Motion is approved.
My turn?
It is.
Awesome. Okay. So, this past Sunday evening at about 5 p.m., I decided to head over to the ACJ for a surprise visit. I figured, jail oversight board meeting coming up, I might as well see what's going on. And so when I get there, I could tell it was actually a surprise this time, which was the best part about the visit, was I could tell there weren't notebooks sitting out for me to take notes on as I walked through the jail. I could just tell they were unprepared for anybody to escort me around. So that was the best part about it, is I know I was getting a real look at what was happening. So I start off in intake. I went to intake first because I always get escorted there last, and I figured there was probably a reason for that. And it was packed, right? So I got there, and I was actually able to, usually I'm yelling through the cells. If you've ever been inside of the pod, right, you're screaming up in the metal door in the crack to try to be able to hear people. And so actually the folks got to come out of their holding cell, and I just stood there, and they literally formed a single file line and just came up and just wanted to talk to me. And so I got to talk to a lot of folks. A lot of them have been in there a bunch of times before. A lot of them, this was their very first visit. Some folks had been there since Thursday morning. And again, this was Sunday night. I got there around 5 p.m. And some folks had just been brought in that day. And so I spent a lot of time talking with each and every person that wanted to talk and just figuring out especially how long they've been there, because I realized there was no clearing of intake happening while I was there. There was no medical staff member at the time, which is weird because every other meeting prior to today, we were told there's never not at least one medical person in intake. Everyone else on this board can attest to that. And then suddenly today, after I saw it Sunday, sometimes that happens. That is absolutely unacceptable. But anyway, so I saw that after I was there for about 20-ish minutes, a medical staff person, I don't know what their name was or what their position was, came down and started calling names out. And the COs who were in intake promised me that they were starting with people who had been there more than 24 hours and going from there to try to clear out all that backlog of folks. And what I found out was really they were just waiting for somebody to drug test them so that they could go upstairs. So it was a simple process that didn't need to have any bottleneck or backlog, but because there was no medical staff in there for what seemed like a long time, but again, I only know what I saw when I got there, but there was people who were in there Sunday night who had been in intake since Thursday. So that was the first thing I noticed. I talked to a lot of different people, not really stuff that's relevant to the board. People who were just looking to be connected with bail funds or attorneys or something like that. And Then, after I left intake, I proceeded to go to Pod 1C, which is a female max security pod. Yes, female max. And so that was cool because, usually in my previous visits, I had focused on going to segregated housing units, medical pods, like very specialized pods, and I wanted to just go talk to folks who were just in jail, right? So I talked to the folks on 1C. They brought up a lot of things, specifically the menstrual products, which again, I could not express enough how happy I am that that is happening. They talked a lot, again, I spoke with a person who had experienced an overdose. Her and her cellmate were given what they thought was heroin, and it ended up having fentanyl in it, and they overdosed on it in their cell. Luckily, they were both revived. From what I was told by the other people on their pod, they were very close to not being revived, but that there is Narcan on every pod. So I saw that myself, so that does happen. I do believe, just based off one of the things I saw and from what I heard from especially the girls on that pod, is that these overdoses are happening every couple weeks now, a lot more often, and that they're very concerned about what they call new courts. And again, that's people coming off the streets. They say that that's where the drugs are coming from, and that every time drugs are found, every time there's an overdose, the whole pod gets locked down. And these girls have been there, some of them for a year, almost 2 years, and they're sick of getting locked down all the time because brand new people coming in the jail are bringing drugs. Not to mention their lives are at risk because a lot of these people do battle substance use disorder, and so you show someone some drugs, and it's hard to say no to that when it's in your face and when you're locked in jail. So I talked to them a lot about that. Again, after that, I went to Pod 3B, which is men, medium, maximum. Medium maximum, and talked to those folks there too. Altogether, I was there for 5 hours, from 5 p.m. till 10 p.m., and that was just for 3 places. Like, that's how much these people are just waiting for someone to listen to them and talk to them and hear their concerns, because they don't get to see what goes on in these meetings. They don't have a direct line of access to us. They don't have really any way to be heard except for when someone shows up on their pod that they have no idea is coming. They didn't know who I was. I wore some cute sneakers so that they'd have something to talk to me about and trust me, but other than that, I have no relationship with these folks whatsoever, and they're just begging to be heard. Overwhelmingly, in all 3 of the places that I went, everyone is just begging for Keefe back for commissary. For anyone who's not familiar, Keefe was the old commissary provider. And so when I told these folks, hey, listen, I know we're working on, there's gonna be a new commissary provider, hopefully, but I explained to them how what's happening is the same people who are providing their commissary are providing their meals. And so many folks I talked to, at least 2/3 of the people that I talked to are not eating the meals at all. They're just eating commissary. I know how much that costs. My parents know how much that stuff costs. I'm sure anyone who has loved someone who was incarcerated knows how much it costs to just live off commissary. Not to mention, I promise you're gonna gain a lot of weight because that stuff is not the healthiest food in the world. I know I did. But that was the overwhelming thing, is like, please just give us back Keefe. So not only are the items so much more expensive, and I didn't have to tell them that, they knew. They were telling me, these folks were saving their receipts, they're doing our accounting for us. They literally pulled their receipts and showed me how much money they were getting charged for the same item on Keefe and how much they're getting charged now, and it's absurd. And so, that presents, again, the conflict of interest when you have the same company providing commissary as you have providing the 3 meals a day. So I saw that a lot. Oh God, I was on 3B when the food got sent out. I swear yins are not even gonna believe me what they serve for dinner. So first of all, I have a menu, so I know it was supposed to be served Sunday night. And that is a meatloaf patty with gravy, Boston baked beans, salad dressing on romaine lettuce, a southern cornbread, whipped margarine, frosted cake, and I don't even know what a drink vitamin fortified bulk is. I'm guessing that's like milk. I have no idea. But I know it was supposed to be served on Sunday, and this menu is not secret. This is posted that folks can see what the menus are supposed to be. When I tell you that it was ground up bologna in what looked like uncooked shredded hash browns, and it was just slopped on the plate with 2 cakes, nothing else. Every single person on the entire pod that I was on got that, which meant every single person in the jail got that. It was ground up bologna. Last time I went there, it looked kind of nice. It was 2 chicken patties. There was some gravy on it. It was looked like almost a high school cafeteria. This was disgusting. I would not let my cat eat this food. I could not believe it. So many people just turned the trays away. So many people on the pod, and again, I only saw the food delivered on one pod, the folks already knew ahead of time that they weren't going to accept the tray. They're eating commissary. As I'm walking around talking to them, they're eating cups of noodles. They cannot eat the food. And so again, why does the meal provider care? Because they know that they're making a profit on every single item of commissary they're selling. So when there's no dietitian coming to show up and talk to us, although there claimed to be one, when there's no anyone from Summit coming to talk to us, we have nothing else to look at except for with our own eyes. And that's what I looked at. And when I'm telling you, I have never seen something so disgusting, and I was in that jail for months. I've never seen a meal like this in my life. They didn't even have the whipped margarine. I mean, they didn't even get butter for their cakes, you know, let alone actual edible food. So that's something I really want to highlight, is that I have never seen a meal like that. Literally looked worse than animal food. So I wanted to highlight that a lot because that's what a lot of folks were talking about, is I have to eat commissary every meal. I have no other choice because look what they're serving me. And now you're giving me this company that I didn't ask for. We were happy with Keefe. At least we knew it. They said even the items that are listed on the list that we've seen with the breakdown of prices, more than half of them are out of stock at any given time. So even though it looks like items are being offered, they have never been able to order them. Over and over again, I heard the issue that actually Brian Englert brought to our attention about their ordering commissary. When they go up to get their commissary order, there's items that are missing and they never get their money back. And I know Warden Harper actually spoke to it, and it's not even on the jail. That's the commissary provider who is doing that, who is not refunding their money for items that, again, they purchased for, their loved ones purchased. So that just pissed me off, because if there's anything I like more than anything in the world, it's eating, and they can't even eat unless they're paying exorbitant amounts for the same food that you and I can go down the grocery store and get for nothing. Another thing, a lot of folks were talking about how they used to be able to spend $175 per commissary order, and now it's $150. And what is the reasoning for that, and who decided that? But we got that answer today. Also, I talked to a lot of folks who were talking again about not getting their money for their vaccines and their booster shots. There were some people that I needed to convince, hey, they're making us give vaccines for visits. Well, that's all you got to do. That's all you got to do to get a visit, get a vaccine. I know it's not great, but we're starting to get it back. So I spent a lot of time just educating, telling them, listen, I got it 3 times. I'd get a shot every single week if it meant that I could go back to the Golden Corral buffet again, you know, every single week. And so to see their loved ones, I think I got a couple people convinced, so let's hope for that. But really just overall, there was not a lot of staffing there, which I guess we knew was gonna happen. Also, I went on a Sunday evening. But it just seemed like a lot of the things, you know, you expect when you go into a jail and you say, what can I do for you? I'm Bethany, I'm from the Jail Oversight Board. What can I do for you? You think everybody's going to say, get me out. No one says that. They want food. They want menstrual products. They want time out of their cell. They want to be able to hug their family. They want to be able to not have to use socks and toilet paper as menstrual products because the ones that they're being provided weren't adequate. They want to be able to not have their parents have to take out a second job just to be able to make sure they can eat. Like the things they were asking for, stop allowing people onto our pod who are bringing us drugs. Like they're not asking to stay at the Hilton. They're not expecting these grand things that I think they do deserve, but they're not even asking for that. They just want basic food. They want their commissary to be even semi-affordable, which it has to be within 10% of market rate, and it has not been. And they want also the packages back that Keefe had provided before. Right now there's a male package and a female package, hygiene packages, as opposed to the old packages you used to be able to order through Keefe, which gave them a wide array of products that are not available on regular commissary. So anyways, I mean, I went there not planning on being there for that long, knowing where I was gonna go and what I was gonna do, but I just couldn't walk away because they were lining up and yelling for me from other cells that they just wanted someone to talk to. And they wanted people to know that we're not asking for the world, we're just asking for someone to listen and someone to care. And that's what all of our jobs are. It's our statutory duty. Not you got elected for this, not this is just your passion, but that we actually have a statute that requires that we conduct proper oversight of this jail. It's not a blame game. It's not a who lied to who or who's trying to block who from knowing information. This is our duty. And I please just beg that each of you, please take one trip to the jail at least. I know I've gone with Ms. Klein myself. I know some other folks who are sitting up here have gone before, but please, I beg you, just go in there and just walk around and talk to folks. No offense, warden, but don't let the warden stand beside you the whole time. But just go in there and talk. And I promise you will come back to the next meeting with a very different perspective. And yeah, that's really all I have to say, but I will be typing up my full report and putting it into the record as is required by the statute that John pointed out to us. So thank you very much, and that's all I have.
Thank you for your efforts in going down to the jail and doing your investigation, so thank you for that. Chief?
Want to make a motion to adjourn?
Anyone seconding that?
Second.
Meeting adjourned.
Thanks.
Good evening. Thank you all for attending.